She is concerned about her busy lifestyle and the treatment regimen impacting his day-to-day activities. And patient characteristics are fasting blood sugar is 142 and postprandial is 168, post-breakfast is 168 and HbA1c is 9.8 and the post-dinner, post-lunch is 148 and post-dinner is 284, point to be noted. And serum creatinine is okay and the eGFR is okay, triglyceride is okay and he is having diagnosed case of type 2 diabetes mellitus since last 12 years and she is non-smoker and non-alcoholic. The medical history tells he is moderately adherent to diet and exercise as advised. Dinner is her major meal. She is having a very busy schedule. So type of the time of meals are not fixed. History of GLP-1A 1 year back stopped due to GI disturbances. And she is on sitagliptin, metformin, empagliflozin, and history of father has had a history of type 2 diabetes mellitus along with mother. Mother had also a history of type 2 diabetes mellitus and chronic kidney disease. So how to manage this case? Patient is on 3 OHA and with a history of both parents, history of diabetes mellitus with complications and HbA1c around 9.8%. It's just alarming. How to manage this case? So how do you manage this case scenario? Whether to add another oral anti-diabetic drug or to initiate insulin. So this is one slide. So successive addition of oral anti-diabetic drugs provide lessening effect. The HbA1c will not come down. So substantial benefit from initiating of insulin will be there. So this is one slide. Successive addition of the OHA, oral anti-diabetic drugs, the HbA1c is not decreasing. 1, 2, 3, 4. The HbA1c is not decreasing. This is the pre-treatment, this is the post-treatment HbA1c. So if you use insulin, the mean HbA1c decrease will be more than 1.34% and complications will be less and complications-free survival will be more. So what is the recommendation? The recommendation is by RSSDI 2022 recommends insulin initiation after 3 oral anti-diabetic drugs. This is an Indian society. We are in India, so we have to be abided by RSSDI. So insulin therapy should be considered in all patients failing to achieve glycemic targets on 3 oral agents. However, additional oral agents can be considered in subjects with HbA1c 1 to 1.5% above the mark. So just 1.1 to 1.5 above the HbA1c, you can have a trial of another OHA, but it also is not advisable. So in that patient with 3 oral antidiabetic drugs, now we should go for the insulin. So in Indian reality, it is very important we should consider while choosing insulin therapy for an effective diabetes mellitus management. It is very, very important. So what are the Asian Indian phenotypes? What are the characteristics of the Asian Indians? Develop diabetes at a younger age, progress faster from stages pre-diabetes to frank diabetes, high levels of abdominal fat. This is we call as apple-shaped abdomen. In Western, it is pear-shaped. So high levels of abdominal fat is there. Increased insulin resistance even at low levels of body mass index. Then beta cell dysfunction occurs quite early and rapidly. These are the characteristics of the Asian in Indian. So high carbohydrate diet is a common Indian reality. In STAR study, we have seen 61 to 70% of energy intake in Indians is through carbohydrates present in the diet. High carbohydrate diet leads to raised postprandial glucose levels. This has been revealed by STAR study. So coming to the type of hyperglycemia, there are 4 types of hyperglycemia. That is, one is basal hyperglycemia, second is postprandial hyperglycemia, and another one is postprandial glucose peak and preprandial glycemia. Here, this is the basal hyperglycemia, and this is the PPG peak and preprandial hyperglycemia, and this is the postprandial hyperglycemia. So there are 3 types: 1, 2 basal hyperglycemia and postprandial. The peculiar feature of the significance of this slide is, here you see, let us see that the postprandial hyperglycemia, that is the maximum, it covers the maximum time of the day. 4 hours, 4 hours, and 4 hours. 12 hours. 4, 4, 8, 12 hours. So postprandial phase contributes to 12 hours in a day, in comparison to other basal hyperglycemia. Basal hyperglycemia only this range. And this is the PPG increment, this one. So postprandial phase contributes to 12 hours in a day, and it is very, very important in case of management of the diabetes. We have to manage it very efficiently. As you know, Indians have a high postprandial glucose excursion. It is important to have PPG control right from the start. So the need for a good PPG control right from the start results from a meta-analysis that increased PPG and FBG drive increases HbA1c, and PPG has a stronger correlation with HbA1c than FBG. This is the HbA1c. So maximum contribution is by PPG, postprandial glucose, but also FBG contributes. So FBG, then a cycle goes FPG to PPG. If it increases, HbA1c increases, then FBG increases, then PPG increases. So vicious cycle occurs in the body. So for our information, HbA1c, PPG has a stronger correlation with HbA1c than FPG. Although FBG and PPG both contributes, but PPG has a major role. So what are the ground realities? Ground realities in India, the impact survey was done. Here it was seen that 9 out of 10 healthcare professionals preferred an insulin therapy that would control both fasting blood sugar and postprandial blood glucose. A survey was impact survey. In this survey, the clinicians and the patients, they were given questionnaire, and it was seen what the clinicians want and what the physicians, what the patients want. Everybody wants a good control, and when explained about the insulin therapy, they prefer the insulin. So the clinicians always prefer, in this survey it was seen that always the clinicians prefers the insulin therapy that would control both fasting and postprandial. Then comes this patient Now on 3-OHA, high HbA1c, now we see according to RSSDI recommendation, we will go for insulin. Then what type of insulin? What insulin to consider in this patient? So he has a postprandial excursion of insulin. So we may go with a rapid acting insulin, with a pre-mixed insulin, or with a basal insulin. These are the values I have given a chart. More than 74 milligram percent, a rapid acting or pre-mixed 50-50 we can go for it. Less than 40, a basal insulin or pre-mixed insulin 30-70 we should go. We are not going to the details, but a postprandial glucose excursion more than 74 milligram percent, we have the choice of, in postprandial hike, we have the choice of pre-mixed insulin 50-50, 30-70 or a basal insulin. So coming to the mixed insulins, rapid acting insulin, mainly we prefer in the hospital setup, or we prefer as a short bolus in the management of very uncontrolled diabetes mellitus with the pre-mixed insulins. So we have got three choices. Majority we use the pre-mixed insulins, biphasic human insulin and biphasic analog insulin, and the newer insulin, insulin degludec and aspart. So these are the limitations of the biphasic insulin: lack of mealtime flexibility and opportunity for better PPG control and lower hypoglycemic risks. And in biphasic analog insulin, opportunity, it can be given OD, BD, PID dosing, and lower risks of hypoglycemia versus biphasic human insulin, better PPG control, and mealtime flexibility is there. But limitation, opportunity for better FPG control and lower hypoglycemic risks. These are the limitations. But what are the advantages of this co-formulation insulin? The insulin degludec and aspart. It can be given OD or BD dose with the largest meals of the day. So our meals in both the times, in lunch or in dinner, so either lunch becomes bigger or dinner becomes bigger. Sometimes it is changed also. Sometimes we take a big meal in the night, small meal in the day. On Sundays we take night time a big meal. So it can be changed. The insulin dose can be changed according to the type of meals, and better control of fasting blood sugar and low risks of hypoglycemia in this insulin co-formulation, insulin degludec and aspart. Lower insulin dose is required and less weight gain. The most pondering point in insulin therapy is increased weight. So it is very difficult to manage all the patients who are on insulin. Always you mark the weight increases. So we always advise them to take the weight every week. So coming to the graph, let us see the insulin level touches to the baseline. So after some time, the insulin level is not maintained in the body, and then hyperglycemia occurs. But here in co-formulations, the insulin level, it is maintained, it never touches the baseline. So the lower insulin dose is required and the euglycemic stage is reached. So coming to the degludec and aspart, was only co-formulation insulin till now. This is, here is degludec 70% is there, and aspart, rapid acting aspart is 30%. In degludec, the molecule is in dihexamers, and in aspart it is in hexamers. So the two insulin components do not interact in the solution and in the subcutaneous tissue, thereby retaining their individual properties, in contrast to the insulin analogs. Here the molecules are separate. Insulin components do not interact in the solution, but there the components, they interact. And while releasing, the molecules also, they are released separately. It is due to possible addition of niacinamide in the deglutic. So what are the indices for holistic choice of insulin therapy? It should be have a lower hypoglycemia, and meal time flexibility should be there, simple regimen should be there, and convenience device, and better quality of life, and cost effectiveness should be there, plus efficacy. So these are the choices for a good quality of insulin. All the things: low hypoglycemia, meal time flexibility, simple regimen, and plus efficacy. So then it will be a right choice. So what does the evidence say when you have to consider a co-formulation over a basal insulin? The choice will be there. You can go for a conventional insulin, the human insulins, but when the nature of the job and the working pattern of the patient is different and the blood glucose is not controlled, then we have to go for the co-formulations. We may start from the co-formulation from the beginning, but in selected cases, it will be beneficial. In this case, the patient is had a high busy schedule work, and dinner is the staple. In dinner, it is the staple meal he takes in the dinner time, and HbA1c is very high. So we have to consider the co-formulation here. So if the patient is earlier taking a pre-mixed insulin or a basal insulin, either we have the choice to start with the co-formulation from the very beginning, or we have to convert those insulins to the this co-formulation. So how to convert this basal insulin to this co-formulation insulin? So efficacy should be there. These are the attributes to the degludec and aspart, the co-formulation insulin. Efficacy, then safety, then quality of life should be good, and there should be flexibility to the meals. So that in the conventional insulin, you have to take the insulin in the right time, in the same day, in the same time. There is no flexibility is not allowed. So that gives a big hindrance to the patient, to the usually to the very busy executives. So insulin and aspart offers benefits in reducing the risks of nocturnal hypoglycemia compared to the basal insulin. So simple regimen, this insulin can be administered with any major meals of the day. So initiate with 10 units once daily, then initiate 10 units with degludec aspart with the most carbohydrate heavy meals of the day. So meal size and postprandial glucose response should detect the ratio of the two doses. It does not has to be in 1:1 split ratio for basal insulin. So administer with any major meals of the day, and administer this insulin with two most carbohydrate heavy meals of the day, point to be noted. So practical aspects of co-administration with oral anti-diabetic drugs, switching from basal, pre-mixed basal to this co-formulation insulin. So what are the patient profiles of these initiations? On pre-mixed insulin or in poor fasting, recurrent hypoglycemia, need for flexibility, on basal bolus or unacceptable variability and recurrent hypoglycemia and need for flexibility is there. Patient is a very old person having repeated hypoglycemic attacks. So these are the profiles where this co-formulation should be initiated. So this from other insulins, from how to switch from basal insulin to this co-formulation. Basal insulin, if a patient is taking an OD or BD, it should be started, this insulin should be started on OD or BD also. Dosage may be reduced in those experiencing hypoglycemia previously on this basal insulin. So from if it is to be switched from pre-mixed insulins, OD dose, then 1:1, it should be converted. If BD dose, it can be converted to BD or OD. And TID doses, it can be converted to BD doses. So dosage reduced by 10 to 20% for those experiencing hypoglycemia and HbA1c less than 8%. So from basal bolus, how to switch over to this co-formulation? Twice daily basal 2 times, this is 1 time, and thrice daily, this is twice daily. 4 to 5 times basal bolus, it can be given to BD doses. Means patient is on 3 to 4 times on insulin analogs or human insulins can be converted to these doses, BD doses, OD doses. So switching needs to be individualized based on careful consideration of basal bolus doses, and close blood glucose monitoring is required. So it is the choice of the this co-formulation, choice at the insulin initiation, lower hypoglycemia, mealtime flexibility, simple regimen, convenience device, pain, I mean to say the pain, better quality of life, and cost effective plus efficacy. So now we have come, this patient had on 3 OHA, and patient was put on 8 units of 18 units of, initially we started with 10 units, then to 18 units. The HbA1c was 9.8%, and it went to 7.2% after 3 months. And fasting from 142, it went to 110, and postprandial 284 to 136. So, according to the, here the message is that this insulin has got a flexibility and can be taken amount according to the nature of the meals. Can be taken before the meals, and can be taken 15 to 20 minutes after the meals. If you forget also, you can take. And chances of hypoglycemia is less. The older persons and uncontrolled diabetic patients, we can go for it. Thank you.
Thank you, sir, for your nice and informative presentation. Now the audience can ask questions. If any doubt, they can ask questions.
Mike. Now, I want to tell that from the you are right. You forget about the cost, but come to the quality of treatment. When the quality is there, nobody is bothered about to spend money, number one. So why you are going to Apollo hospital, why you are not going to the district headquarters hospital? Because the quality of treatment where it is available, you must there. So what is, we must want a quality of treatment and quality of, good quality of insulin. Here, my answer is that meal flexibility is not there to these insulin analogs and the human insulins. The patient, you are a working person, you are working in the office, you have got a meeting, you take lunch every day at 1 o'clock, but the meeting is there and continues up to 3 p.m. So after 1 p.m., you get a chance for hypoglycemia also. or else your sugar level, blood glucose level hikes up. But in this case, the meal flexibility is there and the insulin level does not touch to the basal level. And there is a flexibility, you can take this insulin also after 1 hour also. There is no problem. Even you skip this dose also, the basal level lies, it does not touch to the basal level, it does not become zero and blood glucose level is maintained. Even you miss one dose. Number 2, meal flexibility is there and time it can be taken before, and if you forget it can be taken also after. And hypoglycemia effect is a very big problem with other insulins. Here it does not occur, means totally not zero, but the chances are less in old persons, in CKD patients, in cirrhosis liver patients, where the hypoglycemic incidences are very high, we should go for here. Not that I am not telling you go directly come to this insulin analog. You can try with the basal, you can try with the other human insulins. But if you fail, definitely you will face problems with those insulins, and you have to again, we have to switch over to that one. Second is the dose of insulin is less in comparison to the other type of insulin analogs and human insulins.
Sir, rightly, I think we have to move towards the this newer insulin in future. Now, I think we are not getting the Novo made mixed art pen fill. We are not getting the cartridge. So the companies are also towards the this novel insulin, and it is rightly said it is the choice in future. But sir, in Indian scenario, the single dose of IDA-SP may be not covering the other 2 meals. So if we take once, then the other 2 meals are postprandial part is not getting covered, particularly Indian scenario with our eating habits. So in abroad or in Western, they take 1 major meal. So it fits into that once IDA-SP. So in our meal structure, we at least need twice dose. Second thing, even we see this 30-70 mixture, it do not covers the postprandial part. When we make it 50-50, then only we are getting most of the time the postprandial values are within that accepted range or target range. So I think once daily dose, how our physician colleagues are comfortable with regards to that postprandial part. The basal part, the fasting part is okay with once long-acting glargine. So my view is once daily dose little bit for our Indian scenario is inadequate.
Sir,
so for us, this basal bolus is ideal, I think.
so thank you for your opinion, but here basal bolus, which is the recommended one, basal bolus, the chances of hypoglycemia is high in comparison to this co-formulation, number 1. Number 2, this digludic aspart also can be used as a basal insulin because the action of basal, this digludic also is more than 24 hours. If you see, the postprandial part also can be taken care. So it can be also used as a basal insulin. The time of action is more than it is 24 hours. If I am not wrong. And chances of hypoglycemia is less. You can use this one. First to start with that, you have got 2 choices. You can directly come to here, and also you can come through that human that insulin analogs. But if it is an old patient and it is the nature of food, you are talking about the Western countries where 1 major meal is there. But here also the person in India does not take the the quality of meal is not same in the lunch or dinner. So it can be changed here, but in this type of insulin, in human insulin, the dose should be fixed one and the time should be fixed one. Here the flexibility is there, but in your insulin, what you are telling, the flexibility is not there. Okay, the launch, one major meal is there, but in that major meal, if it takes after 1 hour, what to do? If it takes 2 hours after it, so the insulin level won't be maintained there, and again the sugar level will be, blood glucose level will be high. So it can be preferred. I am not telling that you should have it, but it can be used, and your patient response will be better.
Thank you, sir. Now the session is closed, sir.
One question, sir. Sir, the concept of CGM or continuous glucose monitoring has come. So what is your take, how effective it is in the Indian scenario?
Spontaneous monitoring blood glucose.
Continuous glucose monitoring.
Could not hear, sir.
Sir, the concept of continuous glucose monitoring has come. So what is your take, how effective it is in the Indian scenario, and what do you advocate?
Continuous blood glucose monitoring is not recommended in all the cases. Where the cases are not controlled, brittle diabetes, or a case of pancreatic diabetes, type 1C diabetes, there you can go for the continuous monitoring of glucose, where a insulin pump, requirement of an insulin pump is there.
Thank you, sir.
Thank you, sir, very much. I may now request Sanjukta Madam to kindly present a token of appreciation to Dr. P.K. Mahapatra, sir. Dr. Tanti, I may now request Dr. Tandi, sir, to present a token of appreciation to Sanjukta ma'am. And Sanjukta ma'am to Tandi, sir. Thank you, sir.
A very good morning, everyone. Well, moving on ahead with the guest lecture. In this guest lecture, our time duration is 30 minutes, 25 minutes for the presentation, out of which 20 minutes, one buzzer, then again after 5 minutes, one buzzer to mark to end the presentation, and 5 minutes for the interactive session. I may now request Dr. B.K. Nayak, IGH Rourkela, and Dr. A. Shanti Priya, VSP Vishakhapatnam, to chair the session and grace the dais. I may now request Speaker Ms. Manjumal Thomas, Clinical Consultant, Philips India Limited, to present her topic, Paperless ICU.
Hi, good morning, everyone. Let's talk about paperless ICU. This is Manjumal Thomas, consultant, Philips India Limited. So if you're seeing the current trend in India or across the globe, that in terms of data management and information systems, several important trends affecting the healthcare system. Moving from paper-based to computer-based system, moving from local to highly connected global information system, increased focus on data, security, privacy, and ownership, clinical and financial outcome management based on data. So these are the current trends in place. So at the same time, though we are moving towards the digitalization, there are some of the challenges which we are facing in India. So there are a couple of that interoperability challenge between digital systems. So when I say interoperability challenges, such that here, let's say in an ICU, all your systems are not being interconnected. So when we say the HAS doesn't communicate with the PAC systems or with the devices. So when we have all these things collectively put together, then it can make a lot of changes. And apart from that, there is a concern over the security and privacy with people opting out of some digitalized records. And the most important one, the challenges of meeting declining numbers of physicians and nurses in some countries, especially in India. So here, the healthcare's clear and present dilemma is how to deliver the patient care in face of substantial staff shortages. So the implementing the right technology enables your health system to extend care to more settings and potential populations, improve recruitment, retention, and extension of your clinical resources, provide consistent standard of care for your patients. Here, we are delighted to introduce revision 0.05 as the latest major revision of IntelliSpace critical care and anesthesia. IntelliSpace critical care and anesthesia is largely built on the inputs and feedback from which we have received it from our customers and partnership around the globe, which is available in 17 languages and available in 68 countries. The customers and key opinion leaders from over 68 countries help us prioritize enhancement that support the positive clinical and economical outcomes. And we are currently serving more than 500 customers, including 24,000 critical care beds. the history of revisions based on customer needs. ISO revision Z05 is a continuation of the solution journey which began in 1990 over 3 decades, the first release of CareView Classic. Since then, many major software revisions has been brought to the market. Between major releases, the Philips responds to the immediate customer needs and agile way by releasing the features and service packs. IntelliSpace Critical Care and Anesthesia, we call it as ISA. It is an advanced clinical decision support and documentation solution. Specializing in the acute care environment, ISA works with other clinical information systems and features interoperability that supports documentation throughout the care continuum. It is a single platform for ICU and operation theater for seamless data flow. Improving data flow across the perioperative care journey. Here, if the patient comes to your perioperative section, or let's say it is a planned surgery, the patient comes to operation theater where the patient is being treated and the care is been, or the surgery is completed, patient is being shifted to ICU and general ward. So if you see any workflow for your hospital, if it is from operation theater to ICU or from ICU to operation theater and to ward, if you're seeing any of these workflows, there is a seamless flow of data. ISA, here, as I said, there is a dedicated workflow support for critical care and anesthesia. It is a single platform and it can have different set of documentations across these 2 sections. ISA workflow and features. Here, we are gathering the data from all devices. When I say all the devices, in ICU or operation theater, all our patients are being connected with multiple equipment, such as monitors, ventilators, infusion pumps, anesthesia machines, ABG machines, dialysis machines, or any other machines. Here, we are able to get the data which is from these devices directly, and it is presented in ISA. And it is also possible to get the integration from the hospital information systems, LIS, the laboratory information systems, and hospital packs. In multiple sources, we are collecting the data and which is presented in a way which is meaningful and which is helping you for your data analysis. And you can also have your clinical protocols, advisories, reporting, and data documentations. In an academic-oriented group, I'm sure all of you would be struggling with having data in place. Here, you just need to work on your research papers or the methodology where the system will support you in gathering all the relevant data which is supporting your academic work. ISA is fully integrated into high acuity ecosystems across the critical care settings and operation theater. If you see, let's say that this is here is where the patient is being connected to multiple devices, and through MTIP capsule, the data is being transferred to ISA, and having with the help of IntelliBridge Enterprises, you are also getting the data from device management platforms, HAS, EMR, other clinical applications, and labs. So this helps improving documentations, automation, accuracy, and flow. It is also helping you in reducing the documentation time. In a typical ICU or the operation theater settings, you know that the amount of time which the staffs and the doctors spending on documentation is a huge amount. So here, in the every sheets what you have, the nurses are, checking the vital signs data and the ventilatory data by the RT team. They will be observing that and they are documenting it. So if you have all this data directly getting into your system, how helpful it would be. And this enables a comprehensive data analysis to help identify quality improvements. When we say data analysis, so if you have different bundles, such as SEPS bundle, VAR bundles, or COTI, any of those bundles, if you are able to get it, this will be definitely adding value to your clinical work. Here, with the help of ISA and MTIP capsule, enabling the bedside device connectivity. And Philips capsule is the global leader in medical device integration. Having said, Philips ISA system is capable of connecting with multiple equipments. When you say it is vendor neutral, if you have any make and model of devices, which we have the library details, which we can share it with you, most of that are able to connect with your systems. It has got, as I said, it has got the vendor neutral data acquisition, interoperability, and connectivity. Seamless data flow between the ICU and operation theater. Increase data availability, helps reduce manual documentations and clinical variation through standard templates, supports enhancement workflow and clinical decision support, compliance with HL7 standards for interoperability, single vendor validated end-to-end solution. That is what Philips ISO system is offering. Project management and implementation support, and in addition to that, 24/7 technical support for this project. Here, you can see the ISO flow sheet, just an example of ICU with MTIP data transformation, patient data into clinical insights. So here, you can see that the data which has come from the ventilators, and on the other side, you can have the different segments where you will be able to have the graphical representation and the data. So such that you will be also able to get the data from other devices as monitors and ABG machines also. So this is going to be the operation theater view, the black color one. So here you can see the vital signs data, which is getting captured along with the graphical representation. So here you will be able to see that while the operation is going on, the anesthetist can, instead of having the documentations, he can focus on your patient and all the documentations are available with the system. So it is also helping your clinicians' workflow. It is an integrated data management to support the efficient clinical processes. It helps you in streamlining your clinical workflow, span of perioperative process from pre-anesthesia assessment to procedures, post-operative care and reporting, create an ongoing record for the patients receiving care both in operation theaters and ICU. It is automating your documentations for verification, clinical reporting, and most importantly, for your research. Here for operation theaters, when you are having, we can have multiple templates which can help you in saving your time. If it is for a cardiac case or if it is a neuro case, depending on your case workflow, you can have your templates. And again, if you see in this particular picture, the perioperative assessment, you can see that the documentations are very easy. So some of the fields are drop down, or it could be just a radio button. You just need to select the data, and with the minimal amount of documentation, you are able to complete your patient record. And this is site manager. For any hospital, the infection control is the major interest, and the source of major, infections would be from different sites the patient has. Here you are able to see the sites, the output sites, and the intake sites. At a glance, the site manager gives you the view, the patient's line, outputs, and the topical sites. It is a pre-configured body image, front and back views of different age ranges and the genders provided. Adult male and female, child male and female, infant male and female. Charting and intervention on the site can be done via the right-click context menu using the properties. Here, when you mention that the start date of this particular site, the system will give you the duration automatically. When you wanted to evaluate that is it the center line, is it time for changing or not, you don't have to look around. You can have a single view where you can see that yes, it is 5 days or 7 days, it needs to be managed. So it also helps you for your right ICU management of your multiple lines your patient has. And advisories. Making advisories more meaningful to the users for enhancements. Enhanced advisories visualization and actions based with advisory, level of severity based with advisory. So when you say advisory, so this is something helping you in making the right decision. Suppose if your patient is having different combinations of symptoms associated with lab data. The patient is having slight fever, and your lab report says that patient has the increased WBCs, or the devices says that the patient is having tachycardia. Before even the clinician notice that, or the system will collect all this information, it will throw an advisory saying that there is a chance for infection. Sister, you need to intimate the same with your clinician. So this is something, these advisories are helping your nurses to reach out to you at the earliest so that some of the adverse events can be reduced. So it is just an example. So similar to that, you can also generate multiple advisories depending on your area of interest. So in certain cases, when the potassium is high, or if you see that some of the values are different from the normal, so how you would like to see it with different combinations, those advisories can be generated. And your clinical protocols will be supported. Then order sets. In a hospital, medications are the important aspect of critical care. So when you see this, at the time of when the patient comes to operation theater or to the ICU, if you're seeing the number of advices or the prescriptions what you give, irrespective of the medications, the lab values, or it could be the investigations. All these things you can do it, at a stretch. When I say order set, it will help you in creating multiple orders corresponding to your patient's age group or the disease conditions pre-configured. So this will help you in saving a lot of time, and you don't miss any of the important medications or your hospital protocols which supposed to be done it for that particular group of patients. This helps you in supporting your decision making process when prescribing standard orders. And apart from that, every day you will be able to review the medicines, what is being done, or depending on your culture reports, when you want to change your medications, it is possible also. And medication administration record. Once you have entered the prescriptions, this is the window where the nurses are able to do the charting. For any hospitals, the researchers says that the medication error is one of the highest fatal one. So here, there won't be any chances of errors when you give the medications, prescriptions in this ISO systems, where sisters are able to see that which is that particular medication and what is the frequency. And if there is any particular instructions, you need to give it along with that, which will be again supported. Then next one, nutrient intake manager goals. Some of the critical patients or neonatal patients, babies, we know that the nutrition management is the key. Here, you will be able to set up the goals, what is appropriate, and you will be able to review daily that those goals have been completed or not. It can be the fluid goals, it can be the protein amount, what you give, or the minerals, what you give. The goals changes charted on the flow sheet are now saved to your database and available as a part of the patient record. It provides a complete overview of when the goals were changed and what actions has triggered. Malambati score. So for any patients, those who needs the operation theaters, the anesthetist will be evaluating as a part of the pre-anesthesia evaluation. Malambati score is one of the most important one. Here, this can be added to the document, which will support the clinician in the assessment and documentations of endotracheal intubation. This enhancement aims to increase the perioperative documentation competence. And dental evaluation also. For an intubation patient, this is most important, where the anesthetist can document the appropriate dental evaluation here. Sepsis bundles. ISA sepsis bundles have been updated to comply with the latest guidelines and the industry standards for the adult populations, which is in line with the latest guidelines of 2018. And this bundle supports an early identification of adult patients at risk of sepsis, supporting physicians to take actions timely manner. And this will also give you the reports that in an ICU, how many of your patients who have been compliant with these bundles. And in the intensive care, starting from the admission to the discharge, you can have multiple documentations. And if you see that in an ICU, there are multiple documentations. So I just have showed you a couple of that, such as Malambati evaluation, prenatal assessments. So similar to that, your history physical examinations, initial assessments, history collections at the time of admissions, and your daily progress notes, checklist, all these things can be documented. In your ICU, the entire patient's file, what you're managing, which can be documented as paperless. And once you have all these documentations, your discharge summary is going to be really easy, because these fields have been filled in one or other documents, and which we are fetching to your discharge summary page, which includes the patient demographics data, primary diagnosis, the walk-in diagnosis, or the final diagnosis, along with the treatments, what is given, and only area which you might have to give could be the discharge advice. So rest of the fields can be automatically fetched from other places which is available. So that is the way the system is helping you in your critical care work, and it is also helping you in reducing a lot of documentation time. ISA key benefits. It helps reducing your manual documentation, so this clinical team can focus on patients. It helps reducing clinical variations through standardized and structured documentations, access relevant patient informations when and where needed within the medical facility, transform clinical data into actionable informations and insight, enhance diagnostic confidence through clinical decision support. Secondary data supports quality and compliance and research. Here, you can also have all your problems based on ICD codings. And when the system is being connected with the PAC system, you can also see that in a single view, you are able to see your patient data, the vital signs data, devices informations, and we can also redirect you to the PACs from a single window where you don't have to manage multiple device, multiple logins for handling your patient care. And this will also support you for your research purpose for giving you the statistics data. And what kind of economic benefits the hospital is going to have? The reduction in length of stay. It is the improved decision-making, better treatment, benefits both patient and hospital by increasing bed turnover, paperless workflow, reduced cost in terms of files and printouts, transfer and accessibility of data is made easier to more efficient, reduction of overtime, elimination of double entry results in decreasing the workload of nursing staffs, scalability up to 2,000 beds, configurability for critical care equipments through one interface. And apart from this can also support you for getting your accreditations, making the hospital a destination for critical care. Easier setting of insurance claims and legal disputes because you have the data available. And for any accreditations, NABH or JCA, there is a set of documentations you should be maintaining. So the system will help you for maintaining that. And this will also, as I mentioned in the earlier slide, it has got the DAR, data analysis and reporting. So which will give you, in an ICU, if you have a couple of patients who has a variation of, or let's say that a patient is having ARDS. So you want to evaluate that, how many patients were having ARDS and what was the medications you have given, or when you had started weaning and what was the response you have got it from all these patients. So these kind of different combinations can help you in getting your workflows or your protocols aligned. And in an ICU, how many patients were intubated, out of which how many had the VAP, or how many were having re-intubations. So these re-intubations and the ventilatory weaning days, all these things can again help you in formulating your protocols. And the bundles reports, glucose compliance reports, and multiple reports you can generate from this particular system. Apart from this, if you have a different combinations of reports, that is also possible to do it. And apart from this, so for the implementations, as I have mentioned, in this particular project, while we are going for paperless ICU, I'm just will summarize it in a few minutes. So in paperless ICU project, all your devices are being getting connected with the system. So it can be ventral neutral systems. So if you have the combinations of monitors and the ventilators in your ICU, it is possible to connect it. And the documentations, what you practice it can be again configured without changing your current workflow. And you will be able to get the reports corresponding to the patient care. So these are some of the publications. I don't think we have the time for that. Any questions?
Thank you, ma'am, for your nice presentation. Any questions from audience? Madam, I have one question.
Yes, ma'am.
Good morning, madam. I am Dr. Sujata from RNL Visakhapatnam. Would you please explain reduction in length of stay by using paperless ICU?
Okay. So when we say the reduction of length of stay, it is very, it's not a I can explain you in the, the number of days how it is reducing in a different way. So suppose when you have all your data in place, suppose if you're taking let's talk about the sepsis part. When you're able to identify the sepsis on time and when you're treating the patient, so the reduction of stay can be there, right? Because at the onset of treatment, onset of event, you are able to treat your patients. And in such that you will be also having multiple data points and you have all your records available saying that we have mentioned about how you are getting the ventilatory as well as the devices data, especially from the monitors. So with the help of that, you are able to take a good decision that is it time for shifting the patient. If it is on time, you are able to shift the patient so that you are able to accommodate another patient. And reduction, that is where the reduction of stay, which is supported by the AISA system. And apart from that, again, the other aspects that for any particular hospital, the first 3 or 5 days would be the revenue for the hospital. Rest of the days when the patient is staying, it is not going to be that revenue generating, right? So it would be from the another patient. So where the bed turnover is something which is important, and when you have a data based system, which will which will help you to make the right decisions on whether it is to shift out or it's for helping that particular patient to stay. So that is where the re-intubation also matters.
Thank you, madam. I have one question.
Yes, ma'am.
What about the data security and patient confidentiality?
Yes. So regarding the data security, it is completely secure, and this particular data will be staying in your hospital premises. The server would be available in the hospital, and the Philips team, if you wanted to, support you for any kind of troubleshooting, which is also done through a secured VPN line, so that there will not be any data breach.
Hello.
Yes, sir.
Madam, what is the cost of converting a conventional ICU to this paperless ICU? What will be the cost around?
Yes, sir. So we can work on that. So there are multiple factors involved there. So when you say the multiple factors, it could be on the how many beds, what we are looking at it, and what is the kind of device integrations. So such that if it is like, there are two sets of, there is a hardware involved and there is a software involved. And apart from these two, hardware and software, there is an IT infrastructure. So what I can do that, the technical team can come to your hospital. We will evaluate the hospital, what kind of products you have, and then I will be able to give you the pricing on that, sir.
Okay, madam. Thank you.
Thank you.
Is there any questions from audience? Or now we're going to program it. Now the session is closed. Is there no
Thank you so
question?
much, ma'am.
No question. Session is closed.
I may now request Dr. B.K. Naik, IGH Rourkela, to present token of appreciation to Ms. Manjumal Thomas. I may now request Dr. A. Shantipriya, VSP Visakhapatnam, to kindly present a token of gratitude to Dr. B.K. Naik, IGH Rourkela. I may now request Dr. B.K. Naik to present a token of appreciation to Dr. Santipriya. Thank you so much, everyone. Now, this was an informative end to a session. We will reconvene in 15 minutes, so be sure to grab a cup of chai and recharge for the next session. Please join us for the refreshing cup of chai. Thank you, everyone.
हेलो हेलो
वो तो लंच में कोई नहीं था, थोड़ा आदमी के टाइम थोड़ा लगाओ ना।
हेलो 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 चेक
नहीं, ठीक है, ठीक है। रहेगा।
Kamlakar.
Hello, hello. Hello, 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 hello. Hello, hello, hello.
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 I request everyone to kindly make their presence in the hall as we are going to start our next session very shortly.
The most awaited session of this AISMOC 2025, the MediQuiz. I request everyone to be seated. I request the steel plants to kindly deposit their rolling trophies at the backstage. All the steel plants, please deposit your rolling trophies.
Welcome back, everyone. The most awaited session in the conference is the MediQuiz, where the medical mind meets. So now get ready to diagnose, treat, and track the ultimate medical challenge. I request our dynamic quiz master, Dr. Jitamitra Mishra, Senior Consultant Anesthesia from Utkal Hospital, Bhubaneswar, to conduct the show with the energetic scorer, Dr. Kashi.
I request all the participants to grace the dais. All the quiz participants, please grace the dais.
Hello, hello.
Yes, sir. It's marking, it's marked. All the tables are marked.
Good morning, everyone. So it is indeed a privilege for me to have been invited to conduct this MediQuiz at this August conference, where I heard just now that this is probably the most important event of the conference. So that puts me under even more pressure than the participants probably. So I met some of them earlier in the morning. I am not sure if they knew that I was the quiz master. So I met some of them earlier in the morning. And to be part of this event, Raurkela I have come many times, but never for this conference. And Dr. Manoranjan, who is a very close senior of mine, and when he called me up in October, right away I said yes, because this was probably a good opportunity where I could come to Raurkela and enjoy the time, because quizzing is something I enjoy. And as we are warming up and the teams are taking their designated places, I hope all the teams have got some papers, pencils, and kindly check your microphones before we go to you. I think Vizag, only one person is there. Somebody else is joining. Dr. Kashi, can we just meanwhile give a thanks to, it's not, so once again, thanks to the organizing committee, and I of course belong to a society called the Odisha Quiz Association, and I am not sure how many of you know, but there is one guy in the HR department here who is also from our association. I know him very well, and I hope he comes down during the quiz. I get to meet him. and of course my tech support team, and also to the industry partners, which is Zydus, who have kindly come forward to sponsor all the audience prizes and the quiz also. And before we start the quiz, I have been introduced. I would like all the team members to introduce themselves. Everybody is now seated and comfortable. So I think we'll start from the host. Please take your seat and introduce.
Good morning. Good morning, everyone. I am Dr. P.J. Roy from RSP Rourkela.
This is Dr. Rajoshi Das from RSP Rourkela. I'm a medical officer.
Good morning, everyone. I'm Dr. Pratyusha from Tata Main Hospital, Jamshedpur.
Good morning. I'm Dr. Ritu Singh, Tata Main Hospital, Jamshedpur.
Good morning, everyone. I am Dr. Pramod Kumar Thakur from BSP.
Myself, Dr. Shiva Martha, medical officer, Bila Steel Plant.
Good morning. This is Dr. Urvi Banerjee from Bokaro General Hospital.
Good morning, everyone. I'm Dr. Anupama Sharma from Bokaro General Hospital.
Good morning. I'm Dr. Rajiv Kumar from Durgapur Steel Plant Hospital.
Good morning, everyone. I'm Dr. Anshika from DSP Main Hospital.
Good morning. I'm Dr. Swati from ISP Burnpur.
Good morning, everyone. I'm Dr. Jitendra Pandey from ISCO Steel Plant, Burnpur Hospital.
Good morning, everybody. I'm Dr. Narayan Swami from Vizag Steel Plant.
Dr. Rajshekhar from RNL Vizag.
So once again, a big round of applause for all those who have been selected by the respective organizations to be part of this prestigious event. And before you start, we go through the rules. So there are no negative markings in this quiz. You will get a +10 on a direct question and also a +10 on a pass question. Okay? So I'll explain. Now the quiz runs on an infinite bounds system. Infinite bounds is something that the teams don't complain that why we have been placed here, that was disadvantageous position, advantageous position to somebody else. It's not like that. If one team gets a correct answer, then the next question will be asked to the subsequent team. So automatically, all the teams will get to answer questions. Okay? Then all the questions are encrypted on a grid system. So I don't know which question I'm going to ask you. So nobody can complain that the quizmaster is favoring a team and all. The team will pick their number. I need question number 23. I need question number 35. And that question will be displayed. So I don't know what is the question inside. I only know the answers. Okay? And of course, there are a lot of audience questions. So, and mobile, I hope everybody switched off mobile, creates a lot of disturbance. And today, the quizmaster decision will be final. Okay? And we can have all the debates after the quiz. Let's have a good show. Dr. Kashi, I think we can go to the quiz proper. So shall we start from Rourkela? Okay. Can you go to the PowerPoint, please? Okay. Just go to the next slide. Okay, so this is how the grid will be. The teams will get a chance to select. Okay, so we can start off with the audience question just to see how it works. Okay?
Okay.
So can we have the first audience question? I hope the audience have a microphone.
Yes, sir. Audience do you have?
Okay.
Audience microphone. आप थोड़ा सा आगे में ही रुक जाओ.
Okay, anybody can answer once we display the question. Question 1, audience. So the image here shows the chromosomal disorder. Now explain and name this disorder, which is often associated with some impairment of cognitive ability and physical growth, as well as facial appearance. Teams kindly desist from answering. So anybody in the audience? Okay. Okay. Please give a microphone.
Trisomy 21.
Okay. Let's see what the answer is.
Down syndrome.
Okay, so whoever is in charge of giving audience prizes, kindly make one. So here, Kashi, we have to hit the home button so that we go back to the grid. And I hope somebody is marking out the questions which we have asked. Okay, so shall we have another audience question or we'll go to the quiz? Okay, one more audience question. Okay. The external surface of dash has many elevations and depressions or furrows, and its print is unique to every individual, as is the fingerprint. The study of these prints is also known as chyloscopy. Lot of raised hands. Kindly give a microphone to somebody new. Somebody new. I'll look for the answer.
Lips.
Lips. No answer in the product. Please answer on the microphone. Okay, so that is how it works. Okay, so we'll go to audience question subsequently. So go back to the home grid. Okay, so I'll start from the home side. First question for Rautala, you pick your number. Don't pick from audience questions. Only the 42 questions.
We'll take question number 3.
They want question number 3. Okay, this question is slightly different. In this question, all the teams get a chance. Okay, so this question, what I'll explain, there will be 4 pictures in this question. Okay, no murmuring from the audience, please. The teams will need to write down their answers for all the 4 pictures, and they have, for each correct picture, they will get +5. Okay, and if they get everything correct and they can connect what the 4 pictures are, they will get +10. If they get all the 4 pictures correct, they will get another 10. Okay, so it is like 20, 10, 10, maximum 40 points. Okay, so even though this is a question for Rautala, all the teams can write down their answer, and whoever is ready can call me, I'll go and check. I also encourage the teams to note down the scores of your own team and the other teams. Okay, even though we have a scorer.
I guess the answers are not to be told in mic, sir.
No, the answers are not to be blotted on the microphone.
Excuse me, sir.
You just have to write the answers on the paper and I will come and check personally.
लिखेंगे और गलत हो जाएगा.
Yeah.
सर नेगेटिव मार्किंग है, अगर लिख देंगे यहाँ पे वो गलत हुआ तो?
No negative mark. It's wrongly mentioned. No negative marking in the quiz. I mentioned at the beginning, no negative markings. So you can let your imagination run wild.
Excuse me.
I'll go to the question.
There is no negative markings?
No negative markings.
Excuse me.
Yeah.
Can I get a paper, please?
Okay. Hey, I think you have a paper.
But we both.
Can you give another piece of paper to all the teams? Okay. So I'm going to a question. Okay. Next. Okay. So these are 4 pictures. Don't blurt out the answer on the microphone. Write your answers and raise your hand. I'll come to the team. There are 4 pictures. And I need 4 names. I need a connection to the 4 pictures. And if somebody gets everything correct, they'll get 40 marks. You tell all what these pictures are. ये क्या लिखा है? Any answers? Not yet. I hope everybody understood the question. Audience, I hope everyone understood what I wanted.
Can you elaborate, sir? About the,
Come again?
can you elaborate about the picture?
No, I want you to see the 4 pictures. And why these pictures are in a medical quiz? Obviously, I'm not asking about an aircraft or a river or a mountain or something like that. There is a specific reason this is part of a medical quiz. Okay. See, medical curriculum can be very boring. हमें फर्स्ट ईयर से सिखाया गया कि रट्टा लगाओ एग्जाम में अच्छा होगा. So let's see the beautiful part of medical science also. Okay, any teams have got the answer? Okay, I'll go check now. I think. Okay, time. Anybody got the connection? What the 4 pictures are?
I think Team Burnpur is ready, sir.
Team?
Team Burnpur.
Burnpur. Okay. Anybody else? Okay, I'll check all the teams. Any answers you have? Any answers? Nothing? Okay. Bilal, you have any answers? You have any answers? You have any answers? Okay, so +5 to Tata, +5 to Rourkela, +5 to Burnpur. Okay, that's it. This is
I repeat, sir. It is +5 to Team Rourkela, +5 to Team Tata, +5 to Team Burnpur.
Okay, I'll just go to the audience before. Anybody in the audience would like to take a chance? Anyone? I think I see a raised hand over there. And anybody can connect the 4 pictures. A microphone, please.
Guinea-born disease,
Okay.
waterborne,
Okay, this is not the same disease. These are all different diseases. Can anyone give me a connection? Please give a microphone to ma'am.
Helicopter team, helicobacter.
Like that. Okay, okay. So this is slightly different from what you all are thinking. These are all diseases named after places. Okay. So Guinea worm is from the country Guinea. Go back to the picture, please. I think everybody has seen enough of me. Okay. That is Rocky Mountains spotted fever. Okay. And this is, if you see carefully on the plane, that is one of the Wright brothers. And on the plane is written St. Louis encephalitis. Okay. St. Louis encephalitis. No, St. Louis is already written there. So I can't give you any mark for that. And the last is the Ebola river. So Ebola virus disease. So these are the connection is that all the 4 pictures are of diseases named after places. Okay, so you see the answer, please. And of course, the quiz is sponsored by Zydus. So big thanks to them. So these are all diseases named after places. Okay, we go back to the home grid.
Home page, yes, sir.
Home page.
sir,
The next question.
sir, actually, guinea pig experiments can be also.
No. I saw your answer. So next question is for Team Tata. Pick your number. We'll go a bit fast after this. So this was a bit of a different question, so I wanted to spend some time on that.
The 20.
20. 2020. Okay. So vitamin A, C, D, and E were named in order as the second, third, and fourth vitamins to be discovered. Okay. But vitamin B, which was discovered first, why was it not named vitamin B and not named vitamin A, but instead was named vitamin B? Vitamin B was the first vitamin to be discovered. But everything was named chronologically, but vitamin B, even though it was discovered first, why was it named vitamin B and not vitamin A? That is a question to Team Tata. Okay, when there is a direct question, I'll give 10-15 seconds, but on pass, you have to answer instantly or we have to pass. Because anyway, all the teams are getting 10-15 seconds to see the question. Okay, Tata, you have an answer? You want to try? No negative markings. You can try anything. Audience, be ready with the answers. In case the teams miss out, always a chance. I hope somebody is noting down the name of the audience member who is giving a correct answer. So they need some goodies at the end of the show. Okay, I'll pass to Villa if you don't have an answer. Villa, you have an answer? Okay. Pass to Bokaro. Please immediately answer.
Could be because of its pronunciation.
What
The
pronunciation?
Greek or French people might have pronounced it as
AFB.
vitamin.
Oh, good guess, but not the correct one. Durgapur?
Okay, as there is no negative marking, so I will give it a try. Because vitamin B has a lot of complexes, a lot of variations, and all other vitamins, it doesn't have all of variations in complexes. So vitamin B12, 9, 6, so that is why maybe.
No, my question was why it was chronologically not named as A, even though it was discovered first.
Just a guess, sir.
Please.
Actually, all the vitamins were as a vital amines, amino acid. Vitamin B was not having the amine chain, and that's why it was not considered earlier as vitamin B.
Okay. So questions will never be so academic. Very light questions. That was a very academic discussion. Okay.
We'll just give it a try, sir. Is it the bioavailability or the vitamins?
More vegetables compared to the other these things.
Okay, but why B? Why not A? Even if it was named as A, see, if my name was named as, instead of Jita Mitra, it was named as Manoranjan Samantra, it wouldn't matter to you. Okay, but why was it named?
Because that's what the bioavailability of the vitamin B is more in
okay.
things than the other.
Sorry, that's not the correct. Raurkela?
They were not considered to be that vital.
Okay, not the right answer. Anybody in the audience wants to try? I want to see a gentleman in a cap. Gentleman in a cap, please, please. No chorus, please.
Because of peri-peri.
So even though it was discovered first, since it was the disease known to prevent beriberi, hence it was named as vitamin B. So excellent answer. And we can go back to the grid, please. Okay. So since none of the teams answered, Team Tata will get another chance to select a question.
So question 9.
Question 9. Okay, the name was not coined for this substance until John Abel, an American doctor, prepared a crude extract of the same in 1897, naming it as X. He was acting on Austrian anatomist Joseph Hertel's suggestion that this name would best describe the structure from which the extract was obtained. In 1901, a Japanese doctor named Joikichi Takamine visited Abel and prepared a pure extract of the active principle from the structure mentioned. This was patented by the said company Park Davis and Co. and they named it Y. So there are basically two names, X and Y. And most of us have the misconception that X and Y are the same. So we use the name interchangeably. So, but in reality, X is an inactivated benzylative derivative of Y. Okay, but we use it interchangeably. So, can you identify X and Y for me?
So X is epinephrine, Y is adrenaline.
Okay, let's see the answer. So, 10 marks for Team Tata. So, team members, you also, no, doesn't matter. This question will not come to you. This was a direct question. If it passes, it will come to you. Okay, that is only for that particular question. So since Tata have answered the question correctly, the next question will be to Team Bhilai. Go back to the grid, please.
10. Question number 10.
10. Question 10. Chandulkar 10. Okay. This English phrase refers to an immediate reaction made without analyzing the causes or facts pertaining to an event. The phrase has its origin in a phenomenon first recorded by Sir Michael Foster in his textbook of physiology in 1877. The phenomenon involves the second, third, and fourth lumbar spinal nerves. So either name the phrase or name the phenomenon. Audience, please your cooperation, no murmuring. Direct question to Team Vilai. I just need the name of the phrase, either the English phrase or the phenomenon. This is a direct question to Team Vilai. You'll get 10-15 seconds to think of your answer, but on the pass, please be ready with your answer. Team Vilai, are you trying? Are you going for it? No harm in trying. Not going for it? You want to pass? Okay. Bokaro, you have an answer? You should be ready with your microphone if you have an answer.
I think it's some reflex.
Okay. Durgapur? Sorry.
Sir, chill down phenomenon, chill down spine.
Sorry.
Is it the deep tendon reflex, the knee reflex?
Let's see the answer. Team Vizag have answered that it's the patellar reflex of the knee jerk. So let's go to the answer slide, please. So anything, if your reaction is more than ordinary, it's called a knee jerk reaction. Okay. So that's the English phrase. And there was a clue in the question, lumbar, L2, and 3 and 4. So knee jerk reaction is what the description was. So correct answer by Team Vizag, 10 points to them. So next question will come to Team Raukala. No, that is how it moves. If somebody answers correctly, the next question will go to the next team. So that way everybody gets a chance to face a question. So next question to Team Raukala. Just to prevent ambiguity, some teams may feel that a strong team is sitting before me, they are answering everything, I am not getting anything. So the rule is of infinite bounces. Suppose you answer correct, automatically the question, next question goes to the next team. If they answer correct, next question will go to the next team. Okay, that is how it works. So that way all the teams will get questions. So next question to Team Raurkela.
Question number 4.
Question number 4, 04. Okay, slightly quirky one. Okay, I hope the audience doesn't mind. Eileen Lickness of Alberta, Canada was attacked viciously by her ex-boyfriend following a nasty breakup. Now, Fernando Frank Chora, who was the boyfriend, charged with attempted murder and aggravated assault with a weapon, allegedly fired a 9mm handgun at Lickness while she was seated in her car. In an amazing twist of fate, the bullet, even after brushing against her chest, was deflected away, leaving her alive and fit to make a complaint and have her ex arrested. So what beautiful miracle of modern science helped Eileen survive? So I need the answer from Team Raurkela.
So when the bullet is fired, the bullet crushes out. The bullet changes its shape. That is how she survived.
Are you referring to a dum-dum bullet?
Dum-dum bullet.
No, that's not the answer I'm looking for. Team Tata. See, even in a pass, you are getting 10 points. Wait. Even in a pass, you get 10 points. So it doesn't matter who is asked the question. Okay. Team Vilai, because in pass, you have to run really fast. Audience, be ready with answers in case the teams miss out.
Pass.
Bokaro. I think Burnpur are burning to answer.
Could be because of the use of seat belts.
Seat belt. Okay, good guess, but not the correct one. Durgapur, you're passing?
Sir, breast implant, sir.
Let's see the answer. So she actually had a silicone breast implant, and that implant got deflated and she survived. Excellent answer from Burnpur. 10 points to Burnpur. And the next question will go to Vizag. Okay, Vizag, you take a pick.
17.
17, 1, 7, 17. Okay, slightly easy or tough, depends on how you look at the question. In 1901, the man pictured here invented a string galvanometer which weighed around 600 pounds and required 5 people to operate. Now, this device used a very thin filament of conductive wire passing between very strong electromagnets. When a current passed through the filament, the electromagnetic field would cause the string to move. A light shining on the string would be used to cast a shadow of the string on an interpretable medium, thereby enabling one to study the movement of the string. So this is a very old machine. Now, who is this guy and how do we better know this machine today? So if you know the guy, you know the machine definitely. Question to Team Vizag.
Is it the X-ray inventor, that is the Roentgen?
Roentgen and X-ray. That's a good answer, but not the correct one. I will go to Team Raurkela.
Is it a polarizing microscope?
Sorry, Tata. Other teams, please read the lines carefully. Okay, Villai, Bokaro. Burnpur seem to be a very strong team. Their power play is going really well. Started well. Team Durgapur. So you want to answer?
Sir, machine is ECG machine.
Okay.
Means.
Okay, we'll go to the answer. Go to the answer, please.
The who is the, you have asked now who is the.
It is or. Who is the guy? Or. Okay. So the correct answer was given by Team Durgapur. So they are on the scorecard now, plus 10 to Durgapur. That is William Einthoven, and that was the early design of the ECG machine. So now since Durgapur have answered correctly, we go back to the grid. Next question will be to Burnpur, direct question. They want question 1. No, that was audience question 1. Okay. Now, a team of researchers at Clemson University in South Carolina found that the saliva spread was the main reason behind the increased bacterial growth, amounting to 1400%. The research team put frosting on a piece of foil atop a styrofoam wheel, which they used to perform the ritual. To count the bacteria, the team diluted the frosting with sterilized water and then spread it out on agar plates for the bacteria to grow. Each of the colonies on the agar represented a single bacterial cell from the frosting. The team of researchers found that the ritual resulted in about 120 different varieties of bacterial growth with each maneuver, and thus highlighting the contagiousness. So what harmless study was this, and about what maneuver? So what maneuver which we see very commonly, and that leads to a lot of bacterial infection. Direct question to Team Burnpur. Others are encouraged to keep reading the question.
Sir, is it greeting by kissing? Greet by kissing.
Greeting by kissing. That's an excellent guess, but not the correct one. Team Vizag, I encourage other teams to go for such wild guesses. Keeps the auditorium alive. Team Vizag, you have an answer?
Is it the culture and sensitivity? Culture and sensitivity?
Culture and sensitivity. No, not a very technical one, sir. Team Raurkela?
Pap smear?
Pap smear. Nothing academic. Team Tata? Something much more common than that. Pass. Team Villai?
Vaccine.
Already passed to Team Villai.
Sir, it agar medium? Agar medium?
Agar medium. Bokaro? Nothing technical.
Handshake.
Handshake. Durgapur?
Mycobacterium tuberculosis Nielsen method. LJ medium.
Okay. I think it was a direct question to Burnpur. Okay, we'll go to the audience. Anybody please raise hands. Okay, we have a raised hand over here. Please, microphone please. When you blow a candle on a birthday, that is the amount of bacteria you are spreading. Okay. So excellent answer. Please note down his name. A round of applause for the gentleman. So since none of the teams answered correctly, another chance to Burnpur to pick a question.
Number 5, sir.
They want number 5. Okay, we need some silence in the audience. Now, this system was legalized in India in 2012 through a Supreme Court. The Supreme Court had actually a ruling favoring it in 2008. And according to the United Nations, has pegged at 400 million, mainly because of the low-cost technology, skilled operators, and scant bureaucracy. However, post the banning of foreign customers in 2012, following issues related to dual citizenships, the industry went into decline, even though the ICMR guidelines were supportive of it. The parliamentary panel recently took this issue up following a high-profile Khandani cases. So, what industry?
So, it's a guess only. Surrogacy.
Let's see the answer. So, it is indeed surrogacy. Round of applause and plus 10 to team from Burnpur. And since they answered correctly, the next question will be to Vizag.
So number 7.
They want question 7. Dhoni fans. Okay. So there will be a sculpture on the next slide. So either you tell me what the sculpture is about, or tell me where the sculpture is present, or whom it is dedicated to. Anything about the sculpture you tell me. If it's a correct answer, I will give you full points. So next slide, please. So this is the sculpture. So either name the person to whom the sculpture is dedicated, or name the area where the sculpture is placed, or why. Whatever you want, anything you want, information you want to give me about this sculpture, if it's correct, you get 10 points. आ जाएगा आपको, घूम के आ जाएगा, पास नहीं होगा तो आ जाएगा. Team Vizag, you are
Outside India or
Can I give hints? All teams? If all teams are...
We don't need.
They are telling no, so I can't give hints. Okay, I'm passing to right. Greece? No. Pass.
So it's for tribute to Alexander Fleming in the Madrid word. He invented the penicillin. So it's a tribute to Alexander Fleming.
Okay, let's see the answer. So this is outside a bullring in Madrid, and this was indeed a tribute by the bullfighters, because bullfighters get injured very often, and it was due to the invention of penicillin that a lot of them got their lives saved. So this statue has been placed as a tribute. Excellent answer by Tata. So plus 10 to Tata, and the next question will be to Villai. Go back to the grid, please. Yeah.
Sir, question number 14.
1-4. Okay. Easy one. Henrietta Lacks started bleeding abnormally and profusely after her 5th childbirth in January 1951. And at Johns Hopkins Hospital, she was diagnosed with malignant epidermoid carcinoma of the cervix stage 1. She was started on radiotherapy for the tumor, and during this process, 2 samples of the cervix were removed, the healthy part and a cancerous part, without her permission. However, her condition worsened and she died of uremia in October 1951. Now, how did the cervical samples that were removed help the man in the picture, or how was he immortalized? Okay, so either you identify something about this, whatever I'm describing. If you give me the correct answer, Team Villai, direct question to you. I'm sure one of the teams will crack this answer. Okay, Villai, shall I be passing?
Sir, vaccine for HPV?
HPV vaccine. Okay, that was a good attempt. Team Bokaro?
Pap smear?
Pap smear, almost on the same lines. Durgapur?
Via visual inspection of acetic acid after 5% of application.
No, nothing like that.
Henrietta Lack, Jonas Salk, polio vaccine.
Okay, I will go to the answer. I'll give it to Burnpur, plus 10. So Henrietta Lacks, her sample are the immortal cell lines from which all vaccine study is done. HeLa vaccine, Henrietta Lacks. HeLa. So HeLa name has been taken from Henrietta Lacks. There is a wonderful movie about this lady. Okay, since she was a black lady, she was not informed and her sample were kept. But this sample helped Jonas Salk develop the first polio vaccine, HeLa cell line. So that is the immortal cell line, still it is present. So round of applause and plus 10 to Burnpur. So again, next question to Team Vizag.
23.
They want 23. Okay. Now, Something the Lord Made is an Emmy Award winning 2004 American television film about a black cardiac pioneer X and his complex and volatile partnership with white surgeon Y, who he was an assistant to. The two worked with cardiologist Z and performed a groundbreaking surgery in 1944 at Johns Hopkins Hospital that is said to usher in an era of modern cardiac surgery. Now, Y was nominated for the Nobel Prize in Medicine several times. Now, either give me the name of the operation or the name of the gentleman. And the operation is eponymous. It is named after these three people, X, Y, and Z. So I need three names, X, Y, Z. Cardiac surgery, three name wala. So that is how easy it gets. Question is very long, answer is very simple answer. I'll come to the audience.
Sir.
Audience is always there. Why is that? You have an answer.
Is it William Harvey
William Harvey.
for bypass surgery?
Okay.
The first cardiac bypass surgery?
No, sorry. That was Christian Bernard. Raurkela? I need all three names.
Coronary angiography.
Sorry, Tata,
The blaloctoxic surgery.
Vilai, Bokaro, Durgapur.
Sir, tetralogy of Fallot surgery, three names, POTS, balloctoxic, and is it?
I will give 7 points to Tata. They were the first to identify. Let's go to the answer. They gave two names correct, so they were the first to give two names. So I'll give 7 points to them. So Blalock Thomas Tossig. Okay, that is Blalock Thomas Tossig repair. And I wanted all three names for 10 more points here.
बाकी का 3 पॉइंट इधर दे दीजिए.
नहीं आपने भी वही दो बोला. आपने अगर तीसरा नाम बोला होता, आपने तीसरा नाम बोला होता, तीसरा बोला नहीं है. ठीक है. Okay, so correct answer by team Tata, they get plus 7. Next question to team Bhulai. If anytime the teams want me to go anti-clockwise, I can go anti-clockwise also. Okay, it doesn't matter. It's the same. Team Bhulai.
Burnpur doesn't mind because they have the points.
15, sir.
They want 15, 1-5. I hope everyone is enjoying the quiz. It's not very boring. Okay, thank you. The audience has to be involved. Otherwise, the quizmaster feels that somewhere has gone wrong. 15, 1-5. Okay. Now, being a city of canals and therefore a city with many drownings, Amsterdam had the first organized groups to respond to incidents of drowning. In August 1767, a few wealthy and civic-minded citizens of the city gathered to form the Society for Recovery of Drowned Persons, currently the oldest society in this field in the world. They established a few recommendations, and these were instrumental in saving the life of over 150 people in the following 4 years. Now, these recommendations are considered to be the first ever example describing what, Team Vilai? Some teams know the answer and they feel that, okay, not sure if the question is going to come by us or not. Vilai, you have an answer meanwhile? They're passing. Bokaro?
Triage.
Triage. Durgapur? They're passing.
So CPR.
Let's see the answer. These were indeed the first guidelines for CPR. They were the first ever CPR guidelines way back in 1767. Excellent answer by Burnpur. They're still going well in the middle overs. So let's go back to the grid of questions. And again, direct question to Team Vizag.
25.
25? Okay, 25. Okay. Now, collectively, the medical profession today is more bloodthirsty than Dracula, who in comparison seems like an anemic vegetarian. Quibs this cartoonist satirist who also happens to be an associate editor with Times of India. One of his well-known creations is the comic strip Dubyaman, a collaboration with artist Neelab Banerjee based on George W. Bush as a superhero that came out post the 9/11 attack at the WTC. Now, he features in this quiz for his satirical column, the name of the satirical column. Okay? So, either identify for me the person or name of the satirical column. Okay? So, obviously, if I am asking a question in the medical quiz, it will have a medical connect. Otherwise, I will not be asking. So, either you name the person or you name the column. I hope some people are still reading newspapers. Team Vizag, Black Friday, Black. That's the name of the column. So why should it feature in a medical quiz? So this question is in a medical quiz, so that answer has to be something. Either you name the person, but his name is there in this quiz because of the name of his column. Shall I pass to Raukala? Okay, passing to Raukala. Tata?
So it was about blood sampling and the pain associated with infections.
Passing, Bokaro. So you are getting 10 points and a pass. You are not attempting. Durgapur?
So, I forgot, actually, don't harass the doctor or don't bore the doctors like that.
I will go to the audience. Anyone wants to raise a hand? Madam over here, please. Second row.
Any column related to jugular vein?
Correct. That is Jagsuraya and the name of the column is jugular vein. So that is why it is featured in this medical quiz. So jugular vein is the name of the column. That is why it is there. Excellent answer. Okay, go back to the grid. I think we'll ask a couple of audience questions. Audience also need to participate. Direct questions.
Can we have the score, please?
Okay, meanwhile, as we are preparing the scores, we can have a couple of audience questions. Okay, then we'll, all the teams, please check the scores again. Question 3, audience question 3 for all the audience. Teams, kindly don't answer if you know about it. Dr. Kashi, audience question 3. Okay, so what binds all these people together? What is common to all these people? Need not identify everyone for me. Okay, sir. Please. Yeah, they all died due to HIV-related illnesses. Good answer, good answer. Okay, back to the grid. Another audience question while the scores are being prepared. Okay, anybody can make a connection between these two gentlemen. No teams, please. Anybody in the audience? I don't need the, if you can give the name of the people also fine, but I don't need that. What is the connection or what is this two pictures about? Anybody in the audience wants to attempt? Correct? Madam is correct. First cloning of a sheep, dolly. Excellent answer. So audience is fully alert. I am happy that organizers have taken good care of the audience and they are all alert at the prime time. So do you have the scores ready? Okay. So Dr. Kashi, can you just read out teams? Please verify if the scores are correct. Hope you are writing down your scores and also the scores of your other contestants.
Okay, the scores are Team Raurkela 5, Team Tata 32, Team Bhilai are yet to open it, Team Durgapur 10, Team Burnpur 45, Team Bokaro are yet to open it, and Team Vizag 10.
So it's a neck and neck contest between, for the timing between Burnpur and Tata, but the other teams, still a lot of questions to go. So where was the last question? Where were we with the last question? Last question was asked to Vizag. Yeah.
I have to pick up.
So Vizag, pick a number.
31.
41.
31.
31. They want 31. Okay. Now, UK rehab is a special place for addiction treatments, especially meant for a particular group of people in this modern age. There's also been an increasing rate of calls of people that are obsessed with this thing after 2012. What is so unique about this rehabilitation center, Team Vizag? Because US and UK, Western world, lot of addictions are there. But what is so special? Why I would like to ask about a rehab center in this quiz?
OCD?
OCD rehab. Okay. Team Raukala?
So is it cell phone rehabilitation center? I mean,
Okay.
screen.
Okay. Tata? Vilay? I will give to Vilay. It is not social media. Plus 10 to Vilay. It is entire social media addiction rehab center. So even though they were close, I didn't utter anything. I wanted any other team to give a better answer. So the better answer is social media de-addiction. So I think Vilay gets on the board now. Just we are telling no, not on the board. So excellent answer from Vilay. Next question direct to Bokaro. 19?
19.
Okay, they want 1919. Okay, when he was in his 6th grade, he was diagnosed with ADHD. His sisters found a way to provide to vent his energy, and he took up this particular sport. He went on to become the greatest Olympian of all time. So who is this person? No murmuring from the audience. Audience sab janta hai, but kindly.
The chess player recently that who has won youngest chess player.
Okay.
Gukesh.
Gukesh. Okay. Durgapur. Bonpur. Passing.
Sir, he is the Australian swimmer, Phillips. Swimmer, sir. Australian.
Raurkela.
Michael Phelps?
I'll give it to Raurkela. It is not Australian swimmer Phillips. It is Michael Phelps.
Australia.
So if you had mentioned Australia,
From Australia.
he is an American swimmer. Okay. So 10 points to Raurkela. Moreover, if you had not mentioned Australian, I would have given you the mark. Sometimes answering too much in Viva is also detrimental. So this is what we learned even today. Sorry about that. So Raurkela gets the correct one. So next question to Tata. Go back to the grid, please.
So 18?
18? 18. Okay, complications during a birth forced his mother's obstetrician to use 2 pairs of forceps while delivering him, accidentally severing a nerve in the process. This caused paralysis of the lower side of his face, including parts of his lip, tongue, and chin, which gave him his signature snarling look and slurred speech. As a result, he was bullied in his childhood, and to cope with this, he got into gym, calisthenics, and workouts. A guidance counselor once told his mother, "Your son is suited to run a sorting machine or be an assistant electrician, primarily in the area of elevator operations." Nevertheless, he always aspired to become an actor and screenwriter, and he went on to become a legendary actor. Everyone in this room, I'm sure, knows him once they see the picture. Direct question to Tata. Can you name the celebrity? Use the microphone, please. Other teams, please be ready with your answer instantly if you know it. Because on pass, I will not wait. Okay, I'll pass to Bilay. Tata doesn't have an answer. Bilay, you want an answer? No, I asked once, but everybody said no. We can go after this question. Bilay passing, Bokaro, Brad Pitt, Durgapur.
Hrithik Roshan.
Hrithik Roshan, Bonpur.
Like that on the Sylvester Stallone, sir.
Let's see the answer. The answer is Sylvester Stallone. So that particular look and voice was due to a childbirth complication. I think this is very famous by now. And I hope everyone in this room can identify this person, even though he was from our generation. Okay. So now, since it was answered by Bonpur, everybody wants us to go anti-clockwise? You're okay with anti-clockwise? Huh?
And also we have to ask the question.
I'll ask question. When we will anti-clockwise, I will go to that team because they answered correctly. You want to go clockwise? Okay. Doesn't matter. Everybody, all the teams are getting all the questions. By now, I think you know the format. Only when you see that some other team is answering before you, you feel like that. Okay. So next question to Vizag. 32. 32. So there will be a picture in the next slide. Which Reckitt Becknesser backed brand's latest advertisement is this? So go to the picture. So this is the advertisement for a particular brand. So team Vizag. Slightly lateral thinking will be needed for this, and the audience will enjoy the answer at the end.
Related to medical?
Yeah, it's a medical product. Reckitt Becknesser जो डेटल वगैरह बनाता है ना कंपनी. Vizag wants to pass? No, it is going clockwise only. Everyone didn't agree for anti-clockwise. Okay, I am passing in 3, 2, 1. Rautala.
Is it insulin?
The ulcer index,
Ulcer index, sorry. Vilai, Bokaro, Durgapur. You want to answer, sir? Bonpur?
Just guess. Durex condom, sir?
Let's see the answer. It is indeed an ad for Durex condoms. And that graph was very symbolic. So good guess from the team from Bonpur. Round of applause for them, and also plus 10 to them. So now we can, if everyone wants, we can go anti-clockwise. Okay. So since we started to go anti-clockwise, next question will be to Durgapur. Durgapur, you pick a number.
29.
29, they say. 29. Okay. I was affably greeted by a couple of chaps lounging at a desk by the window drinking coffee. What's all this about? I asked with an airy way. Whatever. The question is immaterial. So this is a photographer, Anthony Barrington Brown, speaking about a 1950s assignment. So this photographer was called by these two people for an assignment to take a photograph of a particular model in 1950s. And this is how he has described the atmosphere. The next will be a picture of that photo which he has taken. Show me the photo, please. So this is the photo he has taken. Okay. So can you tell me which assignment is this? It is a photo of what? Audience, please. I'd like some more cooperation. We'll come to audience later. Quizzes for the teams. They've been selected by their organizations to be on the podium. Durgapur, you want to guess?
DNA structure.
Let's see the answer. It is indeed the first picture of Watson and Crick with the original model of the DNA double helix. So excellent answer by Durgapur, plus 10 to them. Okay, so since we're going anti-clockwise, go back. Next question will be to Bokaro.
11.
They will go for 11. Okay, so there is some poem starting a novel. The name of the novel is The Calcutta Chromosome, which was written by a celebrated writer, Amitav Ghosh, and the novel begins in New York on a 20th of August. Now, this book is loosely based on the life of the poet who penned the above lines. So, some poet has written this. The poet's claim to fame is all thanks to a chap called Hussain Khan from Calcutta, who was paid 1 anna by the poet every time something happened. Okay? So this Hussain Khan was working with this poet, whose line it is, and this Hussain Khan was paid 1 anna every time something happened. So the name of the book already given, so I don't need the name of the book. Either you identify the person whose line is that, or what is the event we're talking about.
Malaria. It's being talked about malaria. Plasmodium falciparum, malaria. Every time the mosquito bit, the
Exactly, that is the answer I was looking for. Let's go to the answer. Now, these lines were penned by Ronald Ross, and Hussain Khan was received 1 anna for every time a mosquito bit him. So that was the answer I was looking for. So plus 10 to Bokaro. And since they answered correctly and we're going anti-clockwise, next question will be to Vilai.
Sir, 41.
41 they say, 41. So there will be picture of 4 books. Picture there. Okay. So what is common to all these 4 books? Question, direct question to Bhilai. What is common to all these 4 books?
Genetic engineering.
It's about genetic engineering. Okay, Team Tata.
They are written by doctors.
Okay, they're all written by doctors. Let's see the answer. So 10 points to Tata. That was an easy question. So next question to Raurkela. Go back to the grid, please.
40, please.
40. Okay. Now John Nash from the movie A Beautiful Mind. His friend in the movie Beautiful Mind describes this condition as having a dash is like not having enough water in your body to run your Krebs cycle. This phenomenon is medically known as Vaisalgia. But commonly or popularly, how do we know this phenomenon as? Team Vizag. Oh, sorry. Team Raurkela, sorry.
Schizophrenia.
Schizophrenia, okay. Team Vizag. Schizophrenia was a condition in the movie. This is not, that condition is not been by that. The condition's name or medical name I have already given, Vaisalgia. I need the common name. Team Vizag. Passing? Polyuria.
Migraine, sir.
Not migraine. Diabetes insipidus. Again, that's a technical term. I need a common, the name of the medical condition is Vaisalgia. Dehydration, delay. Everybody will identify with the answer, I know.
Excretion.
Be louder because I will ask.
Excretion.
Hangover.
Let's see the answer. Vaisalgia is commonly known as hangover. Okay, so I'm sure everybody after the last couple of nights would relate to this event early in the morning. So, sorry audience, the team scrapped it. Correct answer by Tata, they're going strong. So next question again to Raurkela.
Question 39, please.
They want 39, already gone, 39 is gone. Oh, sorry, 39 is there, 39. Okay, dash has been observed as a contagious reflex. Studies have shown dash to be a sign of empathy or a body's way of controlling its own temperature or a survival instinct from our evolutionary past. So what is X? This X. It is a contagious reflex. Use the microphone, please.
Yawning.
Let's see the answer. It is indeed yawning. एक yawn करता है तो उसके दूसरा person will also start doing that. So this is a contagious reflex. So correct answer by Raurkela, and we are going anti-clockwise. Next question will be to Vizag. Pick a number.
24.
24. Okay. The Ministry of Ayush announced its decision to observe X as the National Ayurveda Day. Go back. As the National Ayurveda Day. And this was observed for the first time on the 20th October 2016. Okay. So forget the date. I need the day. The day, particular day. They say there is a lunar calendar, na, you have a day. Like Holi is a day. It can fall on different dates in a year. Okay. So I need that occasion on for which was chosen as the National Ayurveda Day. I hope all the teams understood the question. I don't need a date. I need a day, particular day. Why that day was chosen as the Ayurveda Day?
Is it Purnima?
Purnima. But there are a lot of Purnimas in a year. Which one? You want to try again? It's a direct question. I'll give you some more time, but not more than 5 seconds.
Guru Purnima.
Guru Purnima. That's a good one. Passing. Budh Purnima. Bokaro. Sushrut's birthday.
Yoga day.
Yoga day.
No, that's already Ayurvedic day. Tata.
Sir, birthday of Dr. Asima Chatterjee. Birthday of Dr. Asima Chatterjee.
Sorry, Raurkela. Sharat's birthday. Audience, I know you have already answered. Madam, here in the front row. Let's answer. It is indeed the Dhanteras, which is actually Dhanvantari Chaturdashi. That is actually the Doctor's Day. As per our culture, we are celebrating on 1st July, but Dhanteras is a real Doctor's Day. So Dhanteras is for Dhanvantari Rishi. Okay, so I think the audience gets 10 points. Okay. So since no one answered and it was a direct question to Vizag, Vizag will get another opportunity to select. 35. They want 35. The earliest recorded attempts at X were carried out in Germany in 1891 by Themistocles Glock, who used ivory, nickel-plated screws, plaster of Paris and glue. On September 28, 1940 at Columbia Hospital, American surgeon Y performed the first modern X. The original material used was a cobalt chrome alloy betallium. A later version, the so-called Y prosthesis, which was introduced in 1952, is still in use today, although rarely. So I need both X and Y. Two names.
X, I think, is the titanium.
Okay. Read the questions carefully. It was the first attempt at titanium. Doesn't sound ring well, huh?
Steel.
Steel, for stainless steel.
Okay. Okay, I will pass, sir. Bodhpur, Durgapur, Bokaro, nothing. Villai, Tata, not trying.
Bones via screws.
Okay, audience, please read the question. I need answer. Madam, please. See, the question is not about the material. This was the earliest recorded attempt at X. So it's a procedure.
Procedure.
X is a procedure. Sir, you want the answer?
Replacement.
Yeah, it was the first replacement. Okay, and why? Anybody can give me the why? Optimal.
Sir, there is an orthopedician waiting here. Sir.
No, so there's an orthopedician. So it is not for orthopedicians, of course. So I had once conducted an orthopedic quiz. This question I picked from that. So round of applause for the gentleman over there and madam, of course. So it was indeed the first total hip replacement, and it was, and the why the gentleman is Thomas Moore. Okay. So this also no team answered, but still since two attempts already given to Vizag, next question will be to Burnpur, direct question. Hope nobody has left off. Still everybody is.
So 16, sir. 16.
Sir, we'll give some time for them to chill off, sir. Some audience questions maybe.
You want to chill off? Nothing.
Continue? Okay, right.
क्या बोल रहे हैं? Okay, Burnpur. James Phipps was an assistant, see the timeline, was an assistant gardener to a famous physician. His claim to fame rests on what the physician described as, on the 7th day he complained of uneasiness in the axilla, on the 9th day he became a little chilly, lost his appetite and had a slight headache, but on the 10th day he was perfectly well. The root cause of his suffering can be traced back to one Miss Sarah Nems. So why should James Phipps or this event being described be part of a medical quiz, Team Burnpur?
Sir, immunization by James Philip was first immunized for smallpox.
Okay, let's see the answer. So this is indeed the description of the first inoculation done by Edward Jenner on his assistant gardener. He was actually a young boy. So he was James Phipps. So plus 10 to Burnpur. So while the teams chill off and you get the scores, we can have some audience questions. Question 5. You wanted to ask something? Oh, please, please. So some audience question. Okay. So what is happening here? What is this? What is being shown here? Why is there in a medical quiz? This picture is called something. This painting is named something. which is very common in our medical literature also. Yeah, there are two photos. The painting on the left, the title of the painting on the left is something which is very common in medical literature. Not the teams. Now is the audience turn. Madam wants to raise. No. Madam over there. Not attached here. I need the exact.
Vancouver.
Vancouver. No. Yeah, but I need the name of that particular name of the painting. No, I'll give you the correct. You identified the condition correctly. But what is that thing called? Huntington's chorea, that particular thing. St. Vitus dance. So that name of the painting is St. Vitus dance. So that is how the symptoms in chorea is described. Saroj, am I right? Okay. So thanks to, while they're preparing the scores, you can go to one more audience question. It always feels nice when the audience participates and gets the answer. It is always makes the quiz master happy that the audience is getting involved. Unless the audience is involved, it is. So now you see something is labeled inside the nose of this astronaut. So what is the purpose of that? Anybody in the audience? Hey.
To see the stachyon tube, patterns of stachyon tube.
Okay. Valsalva maneuver. Because in space you cannot, once you're wearing that helmet, you cannot pinch your nose and do Valsalva. So that is how the Valsalva is done. So correct answer from the audience once again. Are we ready with the scores? Or we go back to the grid? One of the team members is missing. So go back to the grid, please. We can have one more audience question quickly. Okay. Now, the use of chloroform as an anesthetic for childbirth was seen as unethical by many physicians and even the Church of England. But what happened on 7th of April 1853 to change this perception? I want some new hand. No, you have already answered. He has already answered. Ma'am has already answered. No, he has already answered. Okay, have you got a prize? Also, you can answer again.
Labor anesthesia.
That is childbirth is labor anesthesia only. But specific thing happened on 7th April 1853. Somewhere in the back, please. Put a last. Yeah. Lumbar puncture. Chloroform is not used in lumbar puncture. Full marks to madam. It was indeed the childbirth of Queen Victoria. So once a royal childbirth occurred, so that thing was, and then it became the law that you can give. Now it is not illegal. So Queen Victoria loved it so much, she didn't get any pain. Simpson. Anesthetist. Okay. Okay, are you ready with the scores?
Yes, sir.
Okay, so we will go back to the quiz. So quick announcement of the score, please.
Rourkela 25 points, Tata 52, Bhilai 10, Durgapur 20, Burnpur 75, Bokaro 10, Vizag 10.
Burnpur
75.
75. 25 सुनाई दिया क्या? Okay. Okay, everybody teams agree with the scores? Okay, so I think we were और एक बार scores थोड़ा बता दो. Okay, you can give me the sheet. I will just read out the scores. I think this microphone is clear. 52. 52. Okay. So now all the teams are on the board. Vizag, Bokaro, Bhilai, everybody has got 10 already. Durgapur has got 20 and Rourkela close 25. But leading the two teams, I will not say neck and neck fight. Tata is 52, but Burnpur is ahead 75 points. Okay, so I think we had left off with Vizag, the last question. Answered by you. So next question will be to Durgapur. Please pick a number, ma'am. 2. They want question. 2 I think is already answered. 2 is there. Okay, 2 is there. Sorry. Okay. Now, which rather unlikely group of people were the first to elucidate the world about the harms of smoking? The poster on the right is one of the more liked after propagandas. Who or whom? Just tell me who were the first group in the world to ban smoking as illegal. There is some symbolism in the picture which can give you the hint. That question to Durgapur. Other teams be ready with an answer. In case it passes, you have to answer immediately. We are going anti-clockwise. You will be the last person to get. Okay, I am passing in 3, 2, 1. Bokaro? No, that is the question. But who are the first group who banned this? While smoker banned officially by smokers. Army officials. I want something very specific. Bilal? If your microphone is on the table, you are not ready with the answer. Tata?
Germans?
Germans. That is indeed the Hitler who banned smoking first. So that is the symbol. That is how the Nazis used to salute. So that is how the ad they had got. The Nazi salute was something like this. Okay, so correct answer by the home team, Raurkela. No, Germans is not. Germans is written in German. So somebody could guess also from that. So they had a more specific answer. Okay, so Raurkela answered correctly. Next question will be to Vizag. Yeah, you can go for 13. Lucky number 13. Okay. It is a general term applied to malignant neoplastic disorders of a type of tissue named after the Roman goddess of fresh water. The clinical signs of the disease depend largely on the location and their effects on the invaded and adjoining organs like alimentary, extranodal, multicentric. Very common in household pets, it is also seen in human beings, 2 to 3 times more common in men than in women and occur in all age groups. This disease entered the popular consciousness in India sometime in the early 1970s as a lead actor in the movie died through a variant of this condition that affected the alimentary canal. So, what is the disease? Audience, please, I need some cooperation. Direct question to Vizag.
Lymphosarcoma of the intestine.
Okay, let's see the answer. It is indeed the lymphosarcoma of the intestine, not very common in humans, but so nobody knew about lymphosarcoma obviously, but lymphosarcoma of the intestine, when Rajesh Khanna says, everybody I think remembers those scenes. Excellent answer by Vizag. Next question to Bonpur. 8 number, going for question 8. Okay, easy one. Picture is a small vessel for storing vinegar. It was always placed on the table at meals to dip the food before eating. It holds roughly 270 ml and the name of the vessel is also used as a measure for this volume. Okay, so name the vessel. Picture 1, red one.
Acetabulum, sir.
It is indeed the acetabulum. So that thing is called acetabulum 270 ml was the hint, and probably they knew the answer already. So they're just playing along with me. And excellent answer, plus 10 to Bonpur. Back to the grid. Next question to Durgapur.
Sir, 12.
12. They want question 12. So this hand pump doesn't have any handle. Why is that? Team Durgapur.
Is it related to Jon Snow? Is it related to Jon Snow, where epidemiology?
And
Jon Snow.
Can you develop on that?
It is related to PSM, epidemiology, Jon Snow, and cholera.
I'll give it to them. This was the Broadway Street pump which was found to be the source of the cholera epidemic. So Jon Snow went and got the handle removed so that people could not drink water from this pump. So that is still present and it is dedicated to Jon Snow. So excellent answer by Durgapur and 10 points to them. Next question to Bokaro.
26.
26. Okay, now Drosophila melanogaster, I think everybody has heard, used in genetics. Now, Drosophilologists have a tradition of christening new mutants with fun and creative names. Now, often the new names are descriptive, like stuck, dissatisfaction, cockroach, all these varieties. Now, sometimes labs develop themes around which to name their mutants. Now, this gentleman, Tim Tilly, was a researcher at the Cold Spring Harbor Laboratory. He developed multiple memory mutants of Drosophila to an order shock avoidance task. Okay, order shock avoidance task. That is, flies could learn to avoid an order when punished with a foot shock. Okay, so as soon as the flies sat on this, they will get a shock. He named the flies after members in the picture given below. Next one. So he named the flies like this, based on these names. Okay, now go back to the question. So who are these dogs? This is a question directly to Bokaro. I think the question is very straightforward. There is some hints in the question too, if you read the question well. Deliberately, the question has been lengthened so that you get confused in the line. That is how medical science is. You read a big paragraph, but you have to find the gist. Okay, Bokara, I will pass in 3, 2, 1. Vilay. Passing, Tata.
Pavlov's dogs.
Okay, let's see the answer. These are indeed the Pavlov's dogs. Okay, so there is a hint in the question that stop punishment system was there. So those are the names of the dogs used by Pavlov. So Tim Tilly used those names. So excellent answer by Tata. Plus 10 to them. And next question to Rautela. Hope the organizers, we are on time. Okay, thank you. So, Rautela.
Question number 6, please.
They need question 6. Okay. Easy one. Picture is an amphitheater in Bullfinch building in Massachusetts General Hospital at Boston. The location is most famous and named after a 16 October 1846 event, the first of its kind, featuring one W.T.G. Morton and his client Edward G. Abbott. The event involved Morton demonstrating the benefits of a product he called lithium, named after the river Leith, one of the 5 rivers of the underworld, the name itself meaning forgetfulness. The demonstration at Abbott reportedly saying, feels as if my neck has been scratched. So what was the demonstration or what is the product? Next slide please for the image. So this is the place and that is the picture. Direct question to Alcala.
WTG Morton demonstrated the first successful anesthesia and he plugged the two.
Okay, I will give it to them. It is indeed the first demonstration of surgical anesthesia by WTG Morton. The substance was ether and it was indeed for tooth extraction. Okay, full points to plus 10 to Rautela. Next question will be to Vizag. Back to the grid, please.
28.
28, they say. 28. Okay, this is again another sculpture. 2005 sculpture, Heart of Steel. So we are coming for a steel officers conference. So I decided to put this quiz by a German sculptor. Again, Rautela has a German connection. So go back to the question, please. Okay, this is a 2005 sculpture by German sculptor Julian Voss Andre, installed at the First Street A Avenue, city of Lake Oswego, Oregon, USA. The images show a 1.6 meter tall sculpture right after installation, 10 days after installation, and several months after exposure to air and moisture. Okay, so what is the sculpture about? Go back to the picture, please. Next. So the picture on the left is as soon as the sculpture was completed, then that is 10 days after that, that is few months after that. So what is this sculpture about? All steel medical officers. And this is a steel sculpture. Question to Vizag.
Oxidation?
Oxidation. So they wanted to show oxidation. But why will I place that question in a medical quiz? That is an engineering theme, no?
May I?
It's a direct question. I'll give them 15 seconds at least. Okay, I'll pass in 3, 2, 1.
So this is hemoglobin structure.
Okay.
Iron hemoglobin complex.
Okay.
That is.
Okay. Durgapur. Passing? Bokaro, passing, Bhilai, passing, Tata.
The structure of hemoglobin upon exposure to air, the rusting happens, so it demonstrates the affinity of hemoglobin to oxygen.
I will give +3 to them and +7 to them. +3 to Dhanpur because they identified it, but they gave the principle why the sculpture was taken like this. It is indeed the structure of hemoglobin, but the sculpture and photographs were taken just to show hemoglobin's affinity to oxygen. That is the answer I wanted. Quiz master's decision is final, sir. Okay. Okay. +3 to Dhanpur and +7 to Tata. Okay. So since Tata answered correctly, next question will
Sir,
come.
last time it happened 7 to then 3 to.
It is at my discretion. I don't know any of you, so I just go with the situation because that was the answer. The quizmaster will have some answer in his mind. I needed that key word which she gave me. So direct question to Raukela.
Question 21, please.
21. Okay. The history of the word originates from the Roman times, during which a criminal charge meant presenting the case before a group of public individuals in the forum. Now, both the persons accused of the crime and the accuser would give speeches based on their side of the story, and the case would be decided based on that. Which word derived from Latin for of or before the forum? Direct question to Team Raukela. And we are going anti-clockwise. So I just need one key word, medical word. I think you can read it. It is there to read. So I just need a word whose Latin means on or before, off or before the forum.
Disposition.
Disposition. What is that? SOS. SOS. One word.
Submission.
Patient.
Submission.
Submission. We're going all legal. Durgapur. It's not a law quiz. Durgapur. Book. Res ipsa loquitur. Bhilai. Pass. Tata. It was direct question. Audience, anybody? I want to see a raised hand, middle of the third row. Forensic is the word I was looking for. So it is derived, it means off or before the forum. So that is how the term forensic has been described. See, all the answers will definitely make you feel that this deserves to be part of a medical quiz. Okay, so that is how it has been done. Questions deliberately have elongated so that to confuse you in the jargon. So this question I think was missed by everyone. It was a direct question for Raukela. So another direct question to Raukela. 36. Is it available? Yes. 36. Oh, easy one. Give me the safety muscle of the larynx. So I think this.
You have to answer.
Oh, answer you again. I think we have to cancel this question. Cancel. Next. Next slide. Next slide. Go back to the home grid. Sorry about that. Okay. Sorry, my mistake. You pick another number, please.
22, please.
22. Okay. So there will be some images on the next slide. You please explain the connection between the images. Team Raukela. Audience, please. Audience, please. I will come to the audience. We have audience questions also. I am passing in 3.
This is myasthenia gravis.
Okay, just in the nick of time, Raukela answered that correctly. It is indeed myasthenia gravis. Fairly straightforward one. Okay, going back to the plus 10 to Raukela. Next question to Vizag Steel. 30. Okay. In a world wrought with disparities, Iran is the only country in the world where a particular product is sold legally. In Iran's legal markets, the price of the product ranges from $2,000 to $4,000, and in black market could be $160,000, most of which is of course taken by the middlemen. Additionally, when run through the black market affiliated service providers, both the purchaser and seller suffer life-threatening risks tracing its origin to 1960s, what product service combo is being talked about that Australia is just trying to catch up with? Is it the opium? Opium. Okay, past Banpur.
Sir, kidney.
Kidney. So Iran is the only country. Now I've heard that Singapore is also coming there. The only country where kidney can be legally sold. In India it is sold, but illegally. But in Iran, officially they allow somebody to sell it.
Sir, excuse me, sir. Sir, in Singapore it is not like that. Singapore, we can, if you are a fan of someone, there is a fourth.
That is mentioned. The Singapore is not mentioned in the question. The Singapore I heard recently that they are also going towards that. So thank you for the observation. And next question I think will be to Durgapur. Last 4-5 questions. 30? 34. Okay. Now this athlete is Valery Nikolaevich Bromel, was a Soviet high jumper. The 1964 Olympic champion and multiple world record holder. He is regarded as one of the greatest athletes ever to compete in high jump. His international career was ended by a motorcycle accident in 1965. However, he gave fame and acceptance to someone who is a legend in the field of orthopedics. Next. So he gave fame to this person. So I don't need the name of the athlete. I need the name of this person. Of course, he's a doctor. Okay. So this is a direct question to Durgapur. Go back to the question, back. Direct question to Durgapur. Shall I pass? You want to attempt? Okay, passing to Bokaro. Do you want to answer? Bhilai, passing, Tata. You want chance?
Elizarus.
Let's see the answer. It's indeed Elizarus. So this guy underwent multiple surgeries, had leg lengthening. So he gave a lot of fame to Dr. Elizarus. He was actually from Kazakhstan, I think. Kazakhstan someplace. So the name of the athlete was not important, but that is why he featured in this quiz. So the correct answer plus 10 to Raurkela. Next question to Vizag. 33. They want 33. Okay. गलत हो गया ऐसे 33 में 1 आ गया हाँ सर नहीं he clicked 33 go back to the grid go back to the grid go back to the grid
हो गया सर
33 मारो X is a word which denotes the substitution of at two adjacent carbon atoms in a benzene ring. Okay. X also means straight, rectangular, or upright. So what is the word X? Substitution of the carbon atoms in a benzene ring is also called X. And X also means straight, rectangular, or upright. So what is X, Vizag? Burnpur are just itching to go for the answer. I think they know it. They don't know it. Bond? Bond. No.
Guessing
is it ortho? Ortho is the correct answer. Ortho means orthopedics. Orthopedics names comes from the straight child, the upright child. Okay. So ortho is indeed the correct answer. 10 points to Burnpur. They're going really well even in the slog overs. And next question to Durgapur.
37.
27. 37 or 27?
37.
37. Okay. Very easy one. The movie Gifted Hands. The Dash story is based on the life of a neurosurgeon who was also a US presidential candidate in 2016. He has also specialization in this separating the conjoined twins. Okay. Gifted Hands is a book. It's also the name of a very famous movie. The name of the movie is also the name of the particular neurosurgeon. So I need the name of the neurosurgeon. medical quiz should be entertaining. We should have entertainment, we should have sports. So if we cannot ask what is treatment of choice and all those things. वो तो पीजी दे के सब पीजी एग्जाम जैसा हो गया, फिर थोड़ा अलग करके करना चाहिए. So when coming back to the quiz, direct question to Durgapur. Just take a guess. Okay, I'm passing to Bokaro. Bhilai.
It's based on Dr. Ben Carson's.
It says indeed Ben Carson. Ben Carson, Gifted Hands is a very famous movie. He was already a very famous guy because of all this conjoined twin separation surgery. And see, that is what is mentioned in the answer. So 10 points to Tata. Going back to the grid, next question to Raurkela.
Question 27, please.
27. Okay. 3 pictures are there. Please connect them for me. This is a medical quiz. Audience, please cooperate if you know the answers. Don't discuss in a loud voice. The other team may get a hint. You want to go for it? Or I'll pass to Vizag?
That is Salvador Dali and paint.
You mean that painting is deoxyribonucleic acid? That is galaxy-acetyl deoxyribonucleic acid, the name of the painting. That is the medical connection. No, it's not Salvador Dali. Passing to Vizag still. Sir, already passed. Already passed. Vizag.
Sir, all of the medical colleges in New Delhi.
These are all medical colleges in New Delhi. Maulana Azad Medical College, Lady Hardinge Medical College, Vardhaman Mahavir Medical College. Okay? You complicated it unnecessarily. Sometimes when the external asks a question, we should go for a simple answer and not think too much. So, good answer by Burnpur. Going back to the grid, last couple of questions. Question again to Durgapur, between 38 and 42.
42.
Go for the last question, 42. Okay, just connect the 3 pictures. I need a medical term.
Trigeminal neuralgia.
Trigeminal neuralgia is the correct answer. 10 points to Durgapur. Go back to the grid, and before going to the last question of the quiz, which of course is 38 for Bokaro, can we ask a few audience questions? Okay. Audience question 8. Name the movie. एक डॉक्टर की मौत. Correct. Next question, back to the grid. Okay. Now, if everybody knows that ECG V lead is why is it term V? V1, V2, V, right? Na? It is voltage, not ventricle, as we commonly do. Voltage is the correct answer. I think the gentleman there deserves a prize. Back to the grid, please. Okay, 10. Jeevan Bindi or Life Saving Dot is an idea put forward by a philanthropic agency that seeks to help rural women across India to get their daily dose of what? Iodine. No one gets a prize. You get a -1 if you don't know this. Okay, great audience. Thank you so much. Back to the grid, please. Okay, before I ask this question, I must specifically thank Dr. Kashi because this grid type of question he was conducting for the first time. Okay, the problem with this kind of thing is when you're operating a laptop, we usually have a tendency to go next level. But in this kind of grid system, if you go next level, it is obliterated. So now, when we come back to the grid, we know that this question has been asked. So to ensure that every time he has to be very attentive and go back to the home button. So that is something he was doing for the first time. Big round of applause.
Thank you, sir.
As we go to the last audience question and then the final question of the quiz. Last audience question, please.
You must have heard, sir, I'm wiping my finger because it is all sweaty.
I can trust that. Okay. Last audience question. Okay. Now this is very easy one. This is an excerpt from a 1977 article. India's Prime Minister Morarji Desai works 12 hours a day, travels incessantly around India, addressing public meetings, talks with vigor and bluntness to his countrymen, and conducts the business of government wherever he happens to be at the time. What is the secret of this youthful whim? Something of a health food crank, the Prime Minister thrives on a regimen that includes daily dose of carrot or apple juice, milk, yogurt, honey, fresh fruits, nuts and dates, and 5 cloves of raw garlic. And one thing more, dash. Early this month, Desai started a meeting of India's Tuberculosis Association by informing his audience that dash therapy was a cure for cancer and cataracts. He claimed to have cured his own brother of tuberculosis that way. In response to a surprise reporter's question, Desai acknowledged for the past 5 or 6 years, I have drunk dash about 6 to 8 ounces every morning. It is very good for you and it is even free. Even in the Bible, he went on to say, so there was a claim that Desai used to drink his own urine. Great participation. I really love that participation and involvement. So no quiz can be successful without a participating audience. If the auditorium is khali, then maza nahi aata hai. Teams, of course, have been selected by the respective organizations. Of course, they are supposed to be the best in their organization. So once again, big round of applause to all the teams as we go to the last question for Bokaro. That is question 38, last question of the day. Let's see what the question holds. Okay, another cardiac question. 27-year-old female gives birth to a term infant after a complicated pregnancy and delivery. Infant is cyanotic at birth. There is a representative gross appearance of the infant's heart. So what is the most likely diagnosis? Bokaro, I'll pass in 3.
TGA.
TGA. Let's see the answer. So we end the quiz on a positive note. So plus 10 to Bokaro. And as we wind up the quiz, I would like to once again thank the organizers and for giving me this opportunity. It was indeed something different for me because usually we go to attend quizzes or participate or conduct quizzes in a more aggressive environment, but this was a much more friendly and at the same time lively audience. So it was very entertaining for us. Hope the teams liked it. I don't know, some may have been put off by the format or the type of questions. I'm not very sure. I tried my best to average out the questions so that, and I don't know who gets asked which question. So I have taken that thing out of the picture. So nobody can say that I have deliberately asked an easy question to someone or like that. So everything was in a grid system. Everything was encrypted. So I hope that you like that format. Any doubts and all, we can always discuss later. And thanks the team for not disrupting the quiz too much. It was very good experience for me. And once again, thank you to Zydus Life Care because they have supported specifically this quiz. So once again, a big round of applause because without industry support, such events very difficult to hold. So once again, my thanks to Zydus Life Care. Thank you very much. Thank you, organizers. And I will come up with the final scores now. Teams, please verify once I tell the score, right? So how many prizes are there? 3 prizes. No. Yes, sir. Before announcing the results, I would like to call my team for the quiz today. Please, let me introduce you to, I think you must have Dr. Kashi, Dr. Rajesh, and Dr. Kamla, Dr. Kamlakar. So these are the people who made the show go well, uninterrupted, okay? So I will probably have more photographs of this event, but they are the people who made it happen seamlessly. Thank you once again, because they ensured that there was not a single glitch. Okay, so Billai settles with 10 points, Vizag with 20 points, Bokara with 20 points, Durgapur, they upped their game and came up to 40. But the third prize winning team is the host team with 65 points. Big round of applause for Raikala. Tata came second with 79 points. And winning by a huge margin is Burnpur with 118 points. So that needs a standing ovation. Thank you.
अरे सर जी आइए, सर आइए, सर जी प्लीज स्टैंड इन, प्लीज स्टैंड इन।
सर ऊपर आइए, फोटोग्राफी।
कहाँ है, कहाँ है, कहाँ है? I may now request Dr. Manranjan Samantrai sir to present a token of appreciation to Dr. Geeta Mitra sir. Please, all the delegates and the audience be present in the hall. रहो। I request Manranjan sir to kindly present a token of appreciation to our energetic scorer, Kasi. So it's a joint venture. Dr. Rajesh, Dr. Kasi, Dr. Kamlakar. Achi, pronto. This will be followed by the valedictory session. I request everyone to please come back soon to the hall. I request Ms. Dr. Sangamitra ma'am to kindly present the token of appreciation, gratitude, everything to our scientific session committee and the backstage dancers. I request Madam to first give to Dr. Mona Lisa. Now to Dr. Anandita. Dr. Namrata.
माइक ऑन करके
To Dr. Rajiv. To Dr. Neelkant.
Last but not
और अभी तक जितना लोग आए हैं सबका लीडर डॉक्टर लीजा दियो। हो गया हो गया। हाँ नेक्स्ट डॉक्टर मधुस्मिता। Next, Joint Secretary for this conference, my brother, PJ Roy.
एग्जाम चल रहा है तो जो जैसा फोटो खिंचा रहे हैं
A very good afternoon. Respected dignitaries, esteemed guests, faculty members, and dear friends, I would like to take this opportunity to express my heartfelt gratitude to each and everyone who has been a part of this event. Your active participation, engaging discussions, and valuable insights have made this conference an wonderful experience movement. As we conclude this event, I hope you will carry with you the memories of those insightful presentations, the lively debates, and the new connections you have made. I hope you will always remember the key takeaway from your discussions and you will apply them in your personal and professional lives. Bidding you goodbye is not that it's an end, it's until we meet again. I now request all our HOMs to kindly grace the dais. Dr. Raj Ranjan Kumar sir, please grace the dais. Dr. Vibhuti Bhushan Karunamay, Dr. Ravindranath M, Dr. Vinita Singh, Dr. Jitendra Nath Sarangi, Dr. Susant Sinha, Dr. Sujit Kumar K.S., Dr. Jayant Acharya, Dr. Manoranjan Samantrai, I may now request Dr. Raj Ranjan Kumar, CMO in charge, DSP Durgapur, to kindly address the gathering.
Good afternoon to all. At the conclusion of this incredible conference, AISMOC 25, we want to express my gratitude to the organizing team to make this event successful. Your team are actually committed to excellence at every moment. We have worked with the passion and your dedication. We also appreciate your hospitality you render to all the guests. And you invited all the like peoples from all the corners of our cell hospitals. There is enrichment of the knowledge and the sharing of knowledge. This should be go on every year. I think this conference should have national or international recognition. We should try for it. Again, thank you for cooperation with all of us. Have a good day. Thank you.
Thank you, sir. I may now request Dr. Vibhuti Bhushan Karuna May, CMO in charge, BSP Bokaro, to kindly address the gathering.
This is good afternoon to all, my respected TD Medical and Health Services Vilai, all the colleagues HOMs of different steel plant hospitals, my colleagues here. It's really, at the outset, I must congratulate and thanks to the team Raulkala, headed by Dr. Jayant Acharya sir. Very fantastically, very marvelously, they organized the event from the inception. The coordinations, the communications, the very well managed. And last 2.5 days, we enjoyed a lot. The hospitality extended, the communication extended, has been an excellence. all the participation from the steel plant hospital also has been very active. The scientific lectures chosen are at par as per the need of these steel plant hospitals. All the guest lecture were of excellence. The environment here, the venue, really, I think no other steel plant having this such like a venue for this type of events. So, again, my heartiest congratulations to whole RSP teams for their excellent endeavors. Thank you.
Thank you, sir. I may now request Dr. Vinita Singh, GM Medical Services, Tata Steel Plant, to kindly address the gathering.
Good afternoon all. I would like to congratulate Dr. Acharya and Team Rourkela for a wonderful 2.5 days extravaganza. And, we are all aware of difficult times and challenges in terms of finance and funds and arranging this a whole lot of years, 1 year's hard work, culmination into this. So great hospitality from the point of being received at the station, very comfortable stay, great food. All these are important aspects of the conference as well. Entertainment was par excellence. We thoroughly enjoyed, so thank you for that. And last and the most important core of the event is the academics. So that academic bonanza was par excellence, and the icing on the cake was the quiz, which, leaving such a beautiful taste behind. So on the whole, I would really like to congratulate Dr. Acharya and team for putting up such a brilliant show. So thank you on behalf of Tata Mail Hospital. Thank you.
Thank you, ma'am, very much. Dr. Jitendra Nath Sarangi, BSP Visakhapatnam, to kindly address the gathering.
Respected head of medicals of the different steel sectors all over the country, fellow delegates, the organizing committee members, a very good afternoon to all of you. At the outset, on behalf of the Vizag Steel Plant, Visakhapatnam Steel Plant Hospital, I sincerely thank Dr. Jayant and his organizing team from the bottom of my heart to have allowed us to come and participate in this conference, because we were not very sure whether we would be able to attend this or not till the last minute, maybe 15 days before. The conference we have all gathered here, and in the last 1.5 days, we have seen various presentation on the different subjects of the disciplines of medicine. This is the uniqueness of the steel plant hospitals, where you get an orthopedician, anesthetist, an ophthalmologist, pathologist, pediatrician, surgeon, anyone who can present a paper here. And the success of the conference belongs to all of you, because without your active participation, this would not have been possible. So, at the same time, I must congratulate the winners, who are going to be, awarded with the prizes in the various sections that we have in the competition category. So, my congratulations to all of them, and specifically the two new things that we had this year. was the walkathon in the morning, which was not there in our conferences earlier. It was a nice experience to go into the Birsa Munda hockey stadium and participate in a walkathon, spread awareness among the people, specifically, when we are saying that Green India Green Initiative, and as Dr. Ravindranath was saying, how we can make our hospitals green. The other thing that we enjoyed was the quiz that was done. Of course, it was not totally into the question answer type, as he said, the quiz master said, that it is not a medical thing, but then you need to keep your eyes and ears open and go beyond the medical thing, and then know about the things which are related to the medical field, so that you can answer the questions. My congratulations to Team Burnpur for have performed extremely well, and also to Team Tata and Rourkela. We will continue to see and see that this type of conferences continue and we participate. And the other thing that we had is the guest lectures and the presentations. They were also and the symposiums that we had, they were all discussed looking into the present scenario, and the debates also, which we all participated as the HOMs, and then to create some amount of masala in the conference venue, in between the main paper presentations. Food was excellent, and as every one of my colleagues have said, the arrangements and everything has been par excellence. I congratulate Dr. Jayant and his team for this effort, and we all have known and seen how they have worked all throughout last 2-3 months and 4 months, and maybe before that also, to set up this type of a conference. Again, congratulations to them, and best wishes to the team Durgapur, who is going to take up for the presentation for the conference next year. Thank you.
Thank you, sir, very much. Dr. Sushant Sinha, sir, ISCO Burnpur, to kindly address the gathering, sir.
A very good afternoon to the distinguished heads of medical of the steel fraternity, Dr. Jayant Acharya, CMO IGH and President of AISMOC 2025, all the delegates whose presence has made this conference so worthwhile, the entire AISMOC team who had been working day in and day out for this conference, a lot of people who have been working backstage, ladies and gentlemen, and members of the press and media. I'm honored and delighted to share my views on the last day of AISMOC 2025. Let me begin by saying a big thank you to Dr. Acharya and his entire team, and can we have a loud round of applause for them? Thank you. You judge a conference on many aspects. It depends on the quality of the scientific sessions, time management, the gastronomics, the cultural extravaganza, and some, let me confess that your team has excelled in every department. It was a great learning experience for me, being in the presence of so many eminent guest speakers and delegates as well. I have thoroughly enjoyed the conference and also made friendship with many of you, and I'll be carrying back many fond memories which I'll cherish in the years to come. Sir, on behalf of all the delegates, and especially from my team ISP, I congratulate your team once again for this wonderful mega event. I'm certain that in 2026, Dr. Rajan, CMOIC DSP, will organize yet another wonderful conference. Till then, goodbye to you all. Let me conclude by thanking you for bearing with me. I really tested your patience with my speech. Thank you indeed. In regards to all, Namaste, Jai Jagannath. Thank you.
Thank you, sir. I may now request Dr. Sujit Kumar, KS, CMO Bhadravati, to kindly address the gathering.
Hello. Good afternoon, everybody. Respected HOMs, my dear, and all my fellow colleagues. This was an excellent conference where we could attend. Usually we'll be attending our own respective departments and the subject conferences. Here is a special one where everybody will be meeting each other from all other departments. And it's unique. Usually this will not happen even in IMA, I think. And it's a good conference to attend for everybody, to share the knowledge, to gain the knowledge, and to achieve something. Everything was fine, starting from the hospitality, the hall, the presentation, academics, and the great debate. The food was lip-smacking. Even those who are on fasting, I think, they might have started eating for at least 3 days. So I hope they have all fond memories of this. Once again, I thank the organizing committee, organizing team for their effort and the pain they have taken to arrange this conference is extraordinary. Thank you, one and all.
Thank you, sir, very much. I may now request Jayant Acharya, CMO in charge RSP Rourkela, to present the gathering.
Good morning, all. Respected Ravindranath sir, Dr. Vibhuti, Dr. Vinita Singh, Dr. Sushant Sinha sir, Dr. Raj Ranjan sir, Dr. Sadangi, and Dr. Sujit Kumar. It's like conducting this was a privilege for my part to conduct the conference. And at the end of the conference, it seems like you had conducted a marriage function and then the guests are going and the feeling you have. So, to sum up, in short, 3 things I would like to share. First, the venue. In fact, this is the best venue which anybody can think of. But the thing is, the venue is so big that we are so small for this venue. So, from the outset, the seats were empty, but the scientific content was very good. So that we should be happy about that. So then coming to the team. In fact, my team members, had teamed up
6 months prior to this event, 6 months prior. And it was so excellently they have done it. You cannot imagine, because the apprehension what I was having, because I have never conducted a conference as a nodal person, but my team never let me feel that. They never ever disturbed me in my routine work, and they took the whole responsibility on their shoulders, so I thank them all.
शादी में होता है कि अरे इसको भूल गया, उसको भूल गया, चेहरा देखने से याद आया, वो सब चलता रहा, ठीक है. But we have, as far as I feel, our team has given their best, so I congratulate them again. Regarding the content was thoroughly scientific, because this content was planned again by all the HMs well before this conference, by physically meeting with each other. So that was a very good part of everybody. So that's a very good culture also. So the content was very good, and the icing on that was the quiz. And the whole full credit goes to the quiz master sitting behind. Thank you. Now, to judge the content was a tough thing. And in fact, it is tough. But we have seen to it that there is no bias. We have tried that there is no bias in this. Still, I will congratulate the winners, and I will be very happy if all the team members go with the same spirit like they are winners. Everybody. Lastly, some improvements, some suggestions. We all met yesterday. With a limited budget, the thing is that we are thinking big and the budget is coming slowly, it is waning off. So there is a mismatch what we think and how to cater. So there is a gap. So we were discussing about the gap, how best we can handle that in the next conference. I hope Team Durgapur will handle that issue next time. What suggestions can be done, whether some online things, some minds team, many things we have discussed, and I hope that will reflect in the next conference. So at the end, I am thanking you all for your cooperation, for dancing with us, enjoying music, having food with us, and remaining late till night to maintain the vigor. So thank you all. Have a safe journey back home. Thank you.
I will now request Dr. Ravindranath M. EDMNHS BSL Bhilai to kindly address the gathering.
Very good afternoon to all of you. First of all, sir, I congratulate you, your team in Rourkela, for bringing out one of the best conferences that we have in AISMOC. And this is a very unique, AISMOC is a unique conference in the sense you will get all sorts of specialities here, and you will see an orthopedician deciding upon ENT specialist paper, and a physician deciding about on gynecologist paper, and so on. So this combination is very unique, which we should prop up and say that this is a wonderful conference and market it in a better way. So that part is slightly lacking, because that marketing also needs a lot of money. Another thing, important thing with all the people who have already said, is the live streaming. If you see the streaming, if you were clicking that link, just 2 slides. It was only a difference of 2 or 3 slides that we were already getting on the screen. So our friends there were in Bhilai, they captured certain photographs and already made WhatsApp to us. So they were also watching there. So in that way, I think the audio-visual communication was there, though there were minor glitches here and there. But overall, it has been good. The timing factor, everything was well maintained. 1 or 2 things that I should always say this: all of us, when we participate, we take back some ideas. Actually, we don't learn much. We may be impressed by certain ideas. So we have to go back and do these things. These things are being done in my hospital also, but I should also record things and create a scientific issue out of it. That part we should learn. It is not that, that is one of the important things. So we'll see some people even from mines also participating. How should we include the mines participation in an academic area? That also should be a thought process. Every conference, OHS also should need more flavor. Somehow, when the presentation completes, somewhere we feel that because steel industries are, the OHS is an integral part of steel industry. Occupational health and safety is an integral part of steel industry. Therefore, somewhere that flavor should be displayed somewhere. And even in the papers, in the OHS papers, that part has to be always kept in mind. How, as an OHS, what is that we contribute towards from the health sector, that has to be brought out. Somewhere that link sometimes is missing, but that was seen in some of the scientific papers, which I should admit. These are a few things. Of course, the food was was very good. All the Utkalika's flavor was always there, and we thoroughly enjoyed it. And of course, the entertainment part is also good. Everybody became part of entertainment. That is the flavor of the conference. Scientific papers, the sessions. Next, the challenge always has been also told by DIC in his initial meeting, that how you will sustain yourself financially. That is what you should look into. See, we being part of steel industry going through a tough time, asking money and getting some patronage through money becomes a difficult task. Sometimes it becomes too difficult. So how we should also think of creating wealth so that we can fund our own conferences. That is one thing we should look into. There were suggestions about whether DNBs have to be incorporated or not, and that suggestion did not come through. We could not make it that because it was predominantly a steel medical officers conference. So that part is likely, but the host always has that advantage of involving lot of ex-doctors and also their peers once in 4, 5, 6 years whenever they come and organize this conference. And another important is this conference has sent out a message in terms of protecting environment and do away with plastic. So when we go back, actually we should think that how we can protect, see the words like decarbonization, green steel, all are being used by our senior management in steel industry. So how we can associate with them, that is one thing that we should also think about. So all these ideas that we get, we should go back and see how we can improve on it and how I can contribute it, or the interactions that you have had may give some insights into how we should perform in future. So don't feel bad that I did not get a prize in spite of my paper being the best paper. That feeling is always there, that sagging feeling is always there. But all papers were making efforts to do their best. But sometimes the judges have to make a decision, and that is how the things go on and goes on in every conference. So once again, sir, I thank the Rollcall team very immensely. All my colleagues have been very cooperative, and because of their cooperation, we could conduct these conferences. Thank you very much. Wish you all the best, and you all succeed in your endeavors.
Thank you, sir, very much. I may now request Dr. Manranjan Samantrai, sir, to narrate the AISMOC journey.
Very good afternoon. Respected dignitaries on the dais, all the heads of medicals of different plants. I just want to tell the last 6 months journey in making this conference. I, as a organizing secretary, representing our team, which worked, supported me very nicely to conduct this conference.
it was in June, the charge was handed over. So then I thought, what I have and what I have to do. Then I found out I have nothing. I contact the organizing team of 2014 AISMOC, and all the documents of 2014 are with Dr. C.M. Rao. I called him. He is suffering from Parkinson's now, so could not remember anything. So I broke 4 almirahs in the dump yard to find out the documents. Then what I got? An acknowledgement slip of PAN card. Then another 2 to 3 almirahs after, I got this passbook on the name of Mr. AISMOC. So I went to the bank. Bank asked me, this is a account opened in 2003, and this passbook issued in 2013. And who are the account holders? There are no photo, no names. It is in the name of Mr. AISMOC. Then, okay, I started the journey from that day. Then I thought, in 2014, we had made an association to open this account. And that document, if I will get, I can get it. So I went to court. There I told, AISMOC नाम का कोई वो डीड बना था, ट्रस्ट डीड बना था क्या? बोला बना होगा. तो 2014 में वो मुझे देखा ऐसे, तो फिर बोला डेट बता दूंगा तो दे दूंगा. So that was the turning point of this AISMOC, because I remember I was in that trust deed. My name was there. I remember that was a very special day for me, because that was my birthday. That's why I told it's, you see 20th January record, 20th June records. Then we found 2 trust deeds, and I requested that person to issue me the copies, authorized copies. So he told, how can I give authorized copies? Who are you? My name is in that trust deed. So he checked, my name was there. Okay, I made some, unofficially made some arrangements, and he given me that trust deed. So with this trust deed, the bank account, and I have that PAN number in the acknowledgement. I went to the bank and they reactivate the account on request. But then comes the physical copy of the PAN. Now the PAN is registered in name of All India Steel Medical Officers Council. Account was in name of Mr. AISMOC. But conference and council, they both starts with C. That's why that PAN I merged with that account. But physical copy is not, the phone number associated with PAN, the mail ID associated with PAN, nobody knows. But through a Bangalore channel, I activated the PAN. Then comes another big burden, GST. GST, we need office. In that trust deed, the office was Dr. Anil Dutt's residence. So we made a rent agreement with Dr. Anil Dutt. Produced that. It got rejected. Because on physical verification, the house was in name of Anil Dutt's father. Then we took out the will of the late father of Dr. Anil Dutt, produced in the GST office, and got the GST number. After that, my colleagues, my friends, they helped me a lot to conduct this conference. I tried my best to do everything. If there is any mistakes, I think you all will forgive me for that. Thank you.
I may now request Dr. Jayant Acharya sir to kindly present the token of appreciation to our HOMs. First to present to Dr. Ravindranath M, ED MNHS BSL Bhilai. Next, Dr. Vibhuti Bhushan Karuna Mein, CMO in charge BSP Bokaro. Dr. Vinita Singh, GM Medical Services, Tata Steel Plant. Dr. Sushant Sinha, CMO in charge MNHS, ISCO Banpur. Dr. Raj Ranjan Kumar, CMO in charge DSP Durgapur. Dr. Jitendra Nath Sarangi, VSP Vishakhapatnam. Dr. Sujit Kumar, KS Bhadravati. Now comes the most awaited program, is the prizes. I may now request Dr. Ravindra M. Sir to kindly give away the prizes for long PG paper. Let's start with bronze. Dr. Sanghamitra Jena. Tata Main Hospital, she bags the bronze prize. Dr. Sangamitra Jena. Then comes silver, Dr. Maya Bose, RSP Rourkela. 3 cheers for RSP, hip hip, hooray. And then comes gold, Dr. Biswarup Mukherjee, ISP Burnpur. Along with the, Dr. Biswarup Mukherjee sir, along with the, he gets again the sponsored by Bhilai, the DCCN Memorial Award also. DCCN Memorial Award. So that is DCCN Memorial Award, sir, in that box. Thank you, sir. I may now request Dr. Vibhuti Bhushan Karunamay, CMO in charge BSL Bokaro, to kindly give the prizes for short paper. Starting with bronze, Dr. Sweta Verma, PSP Bhilai. Dr. Sweta Verma, she bags the bronze prize. Then comes silver, Dr. Ishita Konar, DSP Durgapur. Dr. Ishita Konar. Thank you, sir. And the gold is backed by Dr. Preeti Srivastav, Tata Main Hospital.
मैडम का फर्स्ट प्राइज आने से सबसे ज्यादा रिलीव्ड हम हैं क्योंकि मैडम का पीपीटी में ही 2-3 बार शुरू कराना पड़ा. नाउ आई एम रिलीव्ड.
Thank you, sir. I may now request Dr. Vinita Singh, GM Medical Services, Tata Steel Plant, Ma'am, please give away the prizes for OHS paper. Bronze is backed by Dr. Sheel Kumar Thakur, Bhilai Steel Plant. Silver, Dr. A. Madhvi, Vizag Steel Plant. And the gold is none other than Dr. Anandita Dutta, RSP Rourkela. 3 cheers for RSP. Hip hooray. Thank you, ma'am. I may now request Dr. Susan Sinha, CMO in charge, ISCO Burnpur, to give away the TQM papers, prizes. Now let's start with bronze. Dr. Rishi Anand Tata. And the silver is now shared by two. Dr. Mala Chaudhary, BSP Bhilai, Dr. Ramesh Kumar Hendram, BSL Bokaro. And the gold is backed by Dr. P. Shravan Sai Kumar, RSP Rourkela. 3 cheers for Rourkela. Hip hooray. Thank you, sir. I may now request Dr. Raj Ranjan Kumar to kindly give away the prizes for MBBS paper. The bronze is backed by Dr. Rohit Roy Chaudhary, DSP Durgapur, Dr. Urvi Banerjee, DSP Bokaro. Dr. Rohit, Dr. Urvi. And the silver by Dr. Gargi Ben, RSP Burnpur. And the gold by Dr. P.J. Roy, RSP Rourkela. Cheers for RSP. Hip hip hooray. Thank you, sir. I may now request Dr. Vidyendranath Sarangi to kindly give away the PG poster prizes. The bronze is bagged by Dr. Rajiv Kumar, DSP Durgapur. Silver, Dr. Kumar Rahul, Tata Steel Plant. Gold, Dr. S. Rajeshwar, RSP Rourkela. Three cheers for Rourkela. Hip hip hooray. And one more he gets, that's a sponsored one by Burnpur. Thank you, sir. I may now request Dr. Sujit Kumar to kindly give away the MBBS poster prizes. Bronze is backed by Dr. M. Sujata, Vizag Steel Plant. Silver, Dr. N. Mahita, DSP Bhilai. Gold, Dr. Devdeep Saha, DSP Durgapur. Thank you, sir. I may now request Dr. Manojan Samantraya, sir, to give away the prizes of Mediquiz. Bronze, RSP Raurkela. Team RSP. Dr. Rajeshri Das and Dr. PJ Roy. Then silver is backed by Dr. Ritu Singh, Dr. D. Pratyusha of Tata Main Hospital. And the gold is none other than the burning Burnpur. Dr. Jitendra Pandey, Dr. Adipilli Swati. Thank you, sir. I may now request Dr. Jayant Acharya, sir, to kindly give the prizes. The best male speaker, Dr. Abhijit Dam, BSA Bokaro. Anyone from Bokaro to take his prize on his behalf? The best female speaker goes to Dr. Pushpa Kumari, RSP Raurkela. Dr. Pushpa Kumari. The best team goes to Bhilai Steel Plant. For the best performance and maximum turnout at the walkathon today. Most lively and vibrant team, Bhilai team. Thank you, sir. I request our organizing secretary, Dr. Manojan Samantray, sir, to propose the vote of thanks.
It's my honor to produce the vote of thanks with a deep sense of gratitude and fulfillment. I stand before you today as we conclude the All India Steel Medical Officers Conference. Over the past 2 days, we have had the privilege of engaging in meaningful discussions, exchanging valuable insights, and strengthening our collective commitment to advancing healthcare in the steel industry. First and foremost, I extend my heartfelt thanks to all the heads of medicals for their esteemed presence and enlightened address. Your words have inspired us and reinforced our commitment to ensuring the health and well-being of our workers of the steel sector. I also express my sincere appreciation for distinguished speakers, panelists, experts who have shared their knowledge and expertise with us. All their contributions have been invaluable in making this conference a great learning experience. A special note of gratitude to my fellow organizers, volunteers, technical teams who have worked tirelessly to make this event a success. Without your dedication, meticulous planning, and teamwork, this conference would not have been possible. I also extend our deepest thanks to our sponsors and partners for this generous support, which played a crucial role in making this event a reality. To all the delegates and the participants who joined us from across the steel sector, thank you for your active engagement, thought-provoking discussions, and enthusiasm. Your presence has truly enriched this conference, making it a platform to collaboration and growth. As we bid farewell, I hope that this conference marks the beginning of new collaborations, renewed commitments to excellence in medical care for our industry. Let us keep the spirit of learning and innovation alive as we work towards a better future. Wishing everyone a safe journey back home. Looking forward to meeting you again in next edition of this conference at Durgapur. Thank you. Now, the last launch is there of this conference. It's very delicious. Of this conference. Means all the coupons will be adjusted today, and delicious food is waiting in the launch area. Please.
I request all the Rourkela delegates to kindly, Rourkela delegates Delegates from Rourkela, please stay back in the hall.
All the doctors from IGH are requested to stay back for a photograph. Hello. Oh, say.